Everybody?
It's good to see you.
Hi, everyone. Thank you. What time is it? What time is it? Does everyone have their telephone and radars turned off? Hopefully. So I'm just going to kind of give you all a quick intro on what's going to happen so you know what's up. And as you can tell, the acoustics are pretty sensitive, so we've got to get really quiet because we're going to be zooming into a meeting from this telephone. And this is what's going to happen. So I'm going to introduce the meeting, and then I'm going to introduce Dr. Irene Navrakakis and then Dr. Sarah Peterson. They're both going to present in person in this room, at which point I'm going to disappear in the next room, and I'm going to dive into the Zoom meeting from that room, and you're going to watch that meeting on the monitor, so there'll be sound coming from the TV. At the end of the Zoom meeting, we're going to do a Q&A. We're going to do a Q&A during the Zoom meeting, at the end of the Zoom meeting, and there's paper and pencil at the back. If you've got questions, keep them short, tight, concise, and one of our team members will walk them over to me for the end of the Zoom meeting Q&A. After the Zoom meeting Q&A is over, I'm going to come back into this room, and we're going to have a final Q&A in person between myself, Dr. Navrakakis, Dr. Peterson, and a very special guest, Christine Dolan from CD Media. And that's going to just be among all of us and the four presenters. So that's going to be after the Zoom Q&A. So basically, I'm going to close out the meeting on Zoom, but ignore that because our meeting is going to continue. That's just closing out the virtual presence. Make sense? Yep. Any quick questions? You good? All right. Okay, so we're going to be live here in just a second.
This is best.
You have to be somewhere now. Now she can let me up. You hold me up now. Oh my
I thought I died without it.
Good evening, everyone. Welcome to our 10th Medical Freedom Town Hall event. We are the Delaware Medical Freedom Alliance. My name is Abraxas Hudson.
It's a bit of a lag.
So we have an in-person audience and a virtual audience this evening. We're going to have 6 speakers, a Q&A session, and at the end of the event, we're going to be seeking audience input. So any questions that come up, we're going to cover those at the end. Basically, the nature of the meeting this evening is to do an after-action report of the last 3 years. So this is the 3-year anniversary of 2 weeks to flatten the curve. And as we know, the intention has always been to permanently restructure humanity. And we want to talk about that tonight, how this was not an accident. There was a lot of intent behind the whole operation, and now we've got the receipts to prove it. And basically what has occurred, we believe, is a global crime against humanity, multiple crimes against humanity. At every level, from the very top of government to local suppression of individual liberty, suppression of the operation of small businesses. These shot mandates, no one really knows whether or not to call it a vaccine because we really don't quite know if it even qualifies. They had to keep changing the definition of vaccine in order to make these shots qualify because they're actually telling your cells to produce a toxic substance, which many of us find very disturbing, which is why we said, no way are we playing that game and getting involved. Unfortunately, many people were coerced, threatened with everything from loss of job, loss of schooling, loss of education and a job is a pretty big breach of individual liberty in our opinion. And the real nature of it is these shots were approved by emergency use authorization, and the nature of that is basically they had to pretend there's nothing that could be done if you get COVID, and if there's truly nothing that can be done, they figure, well, the only option is a vaccine. We've got an epidemiologist here this evening, Dr. Harvey Rich, who's going to be talking about the epidemiology of the whole experience. Many people say you don't vaccinate into a pandemic because it just forces variants. But the real reality is they had to suppress treatment in order to get the EUA for these shots. And the doctors presenting this evening are going to talk about how COVID has actually been very treatable since the beginning. Those treatments were very wrongly suppressed, which led to massive suffering, harm, death, and we're just not okay with it, which is why we've devoted a lot of energy over the past 3 years to expose this. So the first speaker I'm going to introduce you to this evening is Dr. Irene Mavrikakis. She's the co-founder of Liberty Speaks and Delaware Initiative for Science and Ethics. She's a Christian and a Mises Caucus libertarian who's a staunch medical freedom, bodily autonomy, and informed consent advocate. She's also a strong ally in the freedom fight here in Delaware and a great friend.
Good evening. I'd like to preface my talk by briefly summarizing the root of our problem. The great Austrian economist and 1974 Nobel laureate F.A. Hayek, in some of his seminal writings like The Use of Knowledge in Society and the aptly titled Competition as a Discovery Procedure, helped us realize that economic competition is how we discover and spread superior information throughout society. It is the freedom of nearly 8 billion minds in their roles as consumers to freely trade their private property for what they calculate to be the best, which motivates companies to innovate and copy each other's innovation, information, and ideas, thus inadvertently turning the entire planet into a global supercomputer via the system of competitive knowledge discovery. For example, an engineer working for Honda in Tokyo discovers superior information by inventing power door locks. The freedom of consumers to freely trade their wealth for the Honda with power door locks motivates BMW, Ford, Toyota, and other competitors throughout the world to copy the power door lock idea, thus spreading superior information in subsequent order throughout society. Private companies are constantly innovating and copying each other's innovations, as well as improving on them. This mechanism of competitive knowledge discovery not only automatically motivates the creation and spread of superior information, it also shapes our morals and civilizes us. It is hardworking, tolerant, courteous people who treat everyone with respect, regardless of age, sex, race, etc., who, thanks to competition, inevitably motivate everyone else to be likewise. As millions of Italians, Britons, Germans, and others from all over the world came to America many years ago, it was ultimately the competition which grows from private property and thus individual liberty, which stripped these people of their otherwise nationalistic, ethnocentric, tribalistic identities. It evolved what came to be seen as the classic American character, wanting to be seen as a reputable and honest businessman or professional who treated everyone with respect, wore a business suit, and opposed all the other ethnocentric ideas. Coercion, whether by the patriarchy, slave master, church, experts, and ultimately competition-immune governments, is not only a burden to those being coerced, but also destroys this wonderful automatic mechanism of competitive knowledge discovery. Because governmental or public sector bureaucracies, which get their wealth through taxes and compulsion, are immune to the competition and information spreading incentives, which motivate private sector entities to keep up with the competition in terms of information and hustle. Thus, freedom and emerging competitive knowledge discovery, not coercive, monopolistic, competition-immune governments led by do-gooder experts and great leaders, as opposed to leading to chaos and injustice, is what, one, enables and motivates the discovery and spread of superior information and subsequent social order. Two, protects us from being coerced into doing something we don't want to do, and thus allows us to live our lives as we wish. Three, civilizes us. And four, is vital to discovering the truth. Therefore, freedom is the ultimate algorithm. Government regulations are coercive, competition-less, monopolistic information which is not subject to continuous replacement via competition. So they paralyze entire industries, slowing down competitive knowledge discovery, driving up costs, leading to more lawyers, regulators, bureaucrats. The increasingly regulated and paralyzed healthcare sector has grown from consuming 5% of the economy in 1960 to over 20% today, culminating in the current COVID mania tyranny. By comparison, the software IT sector has few regulations. There is no American Computer Programs Association monopolizing and paralyzing the knowledge related to software, like the public health entities do for medicine. So free competition motivates the creation and spread of innovations at rapid speeds. The former Soviet Union had plenty of highly educated scientists and experts who ultimately inferior central plans required the coercion of millions, as still happens in Cuba and North Korea. But they were thoroughly crushed by free Americans and their traditions, which respected private property and thus emergent competitive knowledge and discovery. Since the Soviet Union had no competitive knowledge discovery, it quickly got many experts coercing millions in various industries. The scientific monopoly expert or great leader was Trofim Lysenko. His competition-immune ideas related to farming led to massive famines in the USSR, and later the Great Chinese Famine would claim over 20 million lives. Being a favorite of Stalin and also on good terms with his successor Nikita Khrushchev, it wasn't until Khrushchev's downfall in 1963 that Lysenko was thoroughly discredited. In 1964, physicist Andrei Sakharov spoke out against Lysenko in the General Assembly of the Academy of Sciences in the USSR. He is quoted as saying, "He is responsible for the shameful backwardness of biology, and of genetics in particular, for the dissemination of pseudo-scientific views, for adventurism, for the degradation of learning, and for the defamation, firing, arrest, even death of many genuine scientists." Having our own competition-immune, top-down bureaucracies like the CDC, the AMA, the FDA, and the NIAID, we too suffer from a massive lack of innovation in medicine and evolve our own Lysenkos, with Anthony Fauci being the perfect example. I'd like to conclude this preface by highlighting the fact that what we really need is not necessarily the right answers, but the public's understanding of how freedom and resulting competitive knowledge discovery is what will provide the best means of discovering the answers. What follows in the rest of my presentation is just one example of how competition and bureaucrats neglected superior ideas as they wrecked the lives and well-being of billions. We were told that science was the reason for lockdowns, mask mandates, forced or coerced experimental vaccines and biologics, and withholding of early treatments. What science was that? Was science actually applied? As a physician and a libertarian, in my opinion, no. Biological and economic scientific principles were not applied by the decision makers as it relates to the handling of the coronavirus pandemic. Did we live under tyranny here in the US? And if so, at whose hand? Did we follow pseudoscience or science or both? How unscientific or scientific were the decisions made by the decision makers? Was the handling of the pandemic unconstitutional? The federal government should have no power over healthcare or any other public health or public safety matter, as this authority simply does not exist and was delegated to the states or the people in the 10th Amendment. Public health and public safety were not intended as federal authorities, but to be left to the states or the people. Either way, no national government should be making healthcare decisions for individuals, nor forcing policies upon businesses. The CDC, which is funded partly by the CDC Foundation, which receives money from many sources, including not limited to the nonprofit arms of the pharmaceutical industry, and is such not an agency under pure governmental control. Many problems with the entity and the authority it was given exist. It could be argued that the CDC itself is unconstitutional. It only exists and continues to grow based on great suppression era Supreme Court rulings, permissiveness by the states, and scare tactics. Notwithstanding, the fact is, again, the CDC is partially privately funded by the industry via the CDC Foundation that served to financially benefit from vaccine mandates and the like. Additionally, the CDC extended past its authorizing regulations. The CDC's actions during COVID, notably an eviction moratorium decree, expanded any conceivable understanding of what the CDC should be able to do under current regulation. The concept of informed consent and lack of its use during the pandemic is a major crux of the problems of the handling of the pandemic. Informed consent, as it relates to medical procedures and interventions, is inherently tied to our bodily autonomy and the right to life, liberty, and the pursuit of happiness. Did we retain our civil liberties the past 3 years? Informed consent is an important concept and is considered a requirement for the delivery of standard of care. The information provided during the process of informed consent requires the ability to fully understand the potential short and long-term consequence of the procedure. Informed consent also necessitates the ability to decline without force or coercion. The adverse event of the COVID vaccine and biologics were already seen in the clinical trials before they were given to the population at large. Did we have informed consent for the following medical interventions? Masks, vaccines, new experimental medications, forced testing, social isolation. Were these interventions based on the sciences? If so, which ones? And if not, why not? No, we did not have informed consent, and no, these decisions were not based on science, in my opinion. Yes, our civil liberties were infringed upon. Humanity and our immune systems have innate intelligence. Given the proper environment, humanity survives and even prospers. Similarly, given the proper environment, the immune system survives, prospers, and even heals itself. The mishandling of the COVID pandemic is a quintessential example of failed central planning and the inappropriate interrelationship between governmental entities, the pharmaceutical industry, the public health sector, and the medical research sector. What went wrong? The stage was set. H.R. 5546, the law that was passed in 1986 that removed all product liability from vaccine makers and established the Vaccine Adverse Event Reporting System and the Healthcare Compensation Fund, for which $7 billion was already paid out through federal vaccine court before COVID, needs to be repealed. According to its own analysis, the Lazarus report, only 10% of vaccine injuries are even reported. Next, the PrEP Act for COVID removed all product liability for vaccines and biologics and removed all liability from anyone administering the vaccines and biologics. This also needs to be repealed. These two laws, which are quintessential examples of government interference, remove competitive incentives in the vaccine and biologic markets. The clinical trials showed significant issues with efficacy and adverse events. However, since there was no product liability, there was no incentive for pharmaceutical companies to not launch these products. These products should never have been given to humans. This, altogether with the many assumptions of purported safety and efficacy by the decision makers, healthcare providers, politicians, businesses, and that because these biologics and vaccines were giving emergency use authorizations, which implied that they were safe and effective, led to a massive error with the release of these vaccines and biologics upon the populace. From a medical perspective, we can see many problems with the handling of the pandemic. We have already always known that respiratory viruses mutate, and therefore, vaccinating for known to mutate respiratory viruses during a pandemic is questionable science at best. Ignoring natural immunity, which is 27 times more protective, and additionally, not even testing for it, and vaccinating those with likely natural immunity is also questionable science at best. The influenza vaccine increases coronavirus susceptibility by 36%, according to a 2018 Department of Defense study, yet they still recommend it. Additionally, studies have shown that yearly flu vaccine is leading to inadvertent production of IgE, immunoglobulin E, and allergy immunoglobulin to the flu viral antigen, and preliminary studies are showing that a component of the cytokine storm in the COVID vaccinated is also potentially IgE mediated, likely a consequence of the repetitive injection leading to inadvertent immunoglobulin E sensitization. Just think about it. Some people, not all, who get repetitively stung by bees become allergic. The same thing is happening with this repetitive injection. So let's talk about some cold, hard facts. It is not lost on myself and thousands of other physicians that you cannot get emergency use authorization for vaccines and biologics if you have medications available to treat. There are many studies early on that showed ivermectin and hydroxychloroquine and zinc were safe and effective. Yet, there was systematic demonization of its off-label use. Off-label use is necessary for new diseases. For example, aspirin is off-label for heart attacks. Vitamin D levels above 50 nanograms per milliliter is known to significantly decrease morbidity and mortality, yet this was largely ignored. We could have promoted preventative nutraceuticals, vitamin D, early treatment, but this was largely demonized and ignored by public health officials. The overarching theme of pharmaceuticals companies' influence in mainstream media advertising approaching 70%, their product liability protection, their lobbying influence on our legislature has led to a dangerous situation in our country, in particular public health. What can we do? Recall COVID and flu vaccines as respiratory virus vaccination risks and benefits, as well as safety and efficacy needs to be reassessed. Decentralize public health and medical research. Eliminate revolving door leadership positions in public health and pharmaceutical companies. Remove direct-to-consumer advertising of pharmaceuticals. Make illegal pharmaceutical industry legislative lobbying. Completely overhaul our healthcare system. Health and wellness lies in the maintenance of the biochemical order of the human body through nutrition and elimination of toxins. Root cause analysis of homeostasis in every patient with maximization of nutrition and detoxification is needed. Remember, we should always first do no harm. Thank you and God bless.
Irene. That was a very deep dive. But we appreciate it. We need to understand the history of what happened before the COVID era, what happened during the COVID era, so we can be more aware the next time something pops up right here. I think the reality is our radars are all pretty finely tuned to the medical hearing channel, which means the next game may come from a different channel, so we need a full spectrum awareness of what's coming. So one of the topics that she spoke of that resonates with a lot of us now, I think, is the fact that COVID has really exposed the pharmaceutical industry and has also exposed a reality which we call regulatory capture, where the regulatory agencies that are tasked with protecting us are actually in the pocket of big pharma. So the reality there is that now we have a massive loss of faith in public health and also massive loss of faith in the average doctor, because people say, well, gosh, the shots are absolutely dangerous. We're terrified of them. I'm losing family members to them, but my doctor is pushing them. So what's next? So a lot of people are asking kind of like for a full audit of the pharmaceutical industry, but also they're looking for alternatives. So homeopathy, we're going to learn the basics of homeopathy here in a moment from a homeopath that practices here in Delaware. And there are other issues as far as healing goes, and Irene touched on that, kind of creating a biochemistry balance in your body. So nutraceuticals are very important, acupuncture. I mean, the real reality is those of us in the medical freedom movement, we've been demonized, as Dr. Irene said, for promoting vitamin D. And so early on, a lot of us realized this was not about health, where they would say, get healthy, get sunshine. The average COVID death has 5 comorbidities. That's actually like 95% of COVID deaths have 5 comorbidities. So the lesson is get healthy, right? That's the reality. And a lot of us would have preferred that to just full lockdown. So my favorite saying during the whole craziness was, I prefer vitamin D to tyranny. It's pretty simple. So next we're going to hear from Dr. Sarah Peterson. She's a naturopath who concentrates on digestive health. She's had her practice in Delaware for the past 10 years and focuses on nutritional health and homeopathy. She's an active member of Americans for Homeopathy Choice and grassroots efforts in advocacy for homeopathy. In addition to her practice, she currently runs a venue where she offers natural health-focused educational training here in Delaware. Dr. Sarah Peterson.
Thank you so much. I love homeopathy. Probably most of my practice is based on it. And I'm hoping if you don't know about it, that you'll know a little bit more about it after I speak and share with you a little bit. I'm just coming from a 10-hour ride, so I just came from another conference and I'm here. So glad that I was able to show up at about 6:30, but we're here. So anyway, if you know homeopathy, it's been around for 200 years. Dr. Samuel Hahnemann is the father of homeopathy. He has his own monument, the only doctor monument in Washington, D.C. He is very, his philosophy is law of similars, like cures like. So if you're familiar with an onion, I'm going to give you an example of what like cures like means and what law of similars mean with how he would explain it, or how we explain it for us that want to know a little bit more about homeopathy. So if you think of a raw onion, what happens when you cut the onion? Our eyes water, burn, our nose could run. Well, those symptoms, like a cold, you may have a flu-like symptom, or your child may have those same symptoms. They have the burning eyes, they have the runny nose, as if they had cut an onion, but they didn't really cut an onion. So like cures like. So if you would have those symptoms and they would come in, your child or yourself, you would go for albium cepa, which is Latin for onion. And you would go for that, and you would actually take that, and this is a pellet form. This is a boron homeopathy, if you're not familiar with it. They manufacture here in the States. And you would take this sublingually under the tongue, and you would cancel that cold or virus that child has, because it has the symptoms of the onion, even though they didn't cut the onion. But they have the symptoms of a cold that resembles as if they cut an onion. That's a law of similars. That's Dr. Hahnemann that did that over 200 years ago, that we can use today, which is the future of medicine, it's a frequency. So I'm going to share a little bit about some differences and some of the history with homeopathy that's been very effective. Homeopathy has a history of successfully supporting people through epidemics. So, for instance, the flu in the 1900s, they were successfully, homeopaths were able successfully, 90+% success rate, were able to help those people versus allopathic. Huge breakthrough. That's early in the 1900s. In the past 3 years, we've been helping, naturopaths have been helping people to keep them out of the hospitals, to be able to help them to recover from their COVID-like symptoms or flu-like symptoms with COVID, that we're able to help them with homeopathy. Homeopathy is a frequency medicine with no detectable of any raw source. It is diluted, magnified many times, dilution, and is used to individualize people individually. It is not a cookie cutter. Everyone is different. Where allopathic is going to have synthetics and fillers and other products that are actually doing harm to your body. So they also are designed to not to individualize. They think every medicine fits every person the same, which is a cookie cutter. So the medication or the allopathic medicine is used as if someone is all the same, like a cookie cutter. I've been a part of Americans, families of a grassroots program for the last 5 years. And we've been fighting for homeopathy. Now we have been covered under the FDA in 1938 by the Food and Drug and Cosmetic Act. That is where homeopathy laid its rest there. That's where we've been. And we've been fighting for the last 5 years because, as you know, medicine has changed. And now homeopathy, not being the same as allopathic, we are thrown in that same bucket with them. And they have now said, a lot of them don't even know how or what homeopathy is. But we are in that same bucket with them, and they don't know how to deal with it. So instead, they've given us a guidance, a different guidance as of December of 2022, that says all homeopathic manufacturing companies are illegal. So I'm asking, if you can please go to American Families, I can give you the website, to your congressman, because we're doing a law. We're trying to get a law. We're trying to make clear standards for homeopathy so they can have their own bridge to their way of how they do it, and so they can be tested and safe in these manufacturings that we have. That is what we're trying to do. That is what we're asking people to do, to reach out to your congressman. I can give you the website, but it is with Americans of Homeopathy Choice. And on the front page, you'll be able to find your congressman right there and write that you want homeopathy. You want to protect homeopathy. Because homeopathy is the future of medicine. Thank you.
Thank you, Dr. Peterson. We're now going to move to a Zoom meeting, and then I will see you all in just a little while back for the in-person Q&A at the end. Thank you. There's going to be about a minute lag, I believe.
I'll be on in just a moment. Anybody have any questions that they've written down so far that they want to ask at the end? Anybody have any questions? No, take your time. I'll move these things around. I just want to we can get the first round of questions. Did you write down any questions?
Yes, thank you. It's very good to be here with you. Yes, I am an allopathic MD following a homeopath, and I must say that not all of us live in the box. I very much treated my patients with whole person care, and I think that's very important. And since I did a very unique form of practice involving pain, and specifically central pain, which is something most medical doctors know very little or nothing about, it very much incorporates the best of all worlds with regard to medicine and medical practice. So I really appreciate the words of the homeopaths and others who actually claim to have successes, because I think our first tenet is first do no harm, but the corollary is do something that actually does good, that heals, because we are supposed to be healers. So anyway, I was doing that and getting along in my practice, and had an immaculate practice for well over 20 years. And one day I ended up speaking up, and that was on November 7th, 2020, after 8 months after the pandemic was declared. And got myself into trouble because at the time that my wife asked me to speak at the Capitol building in Salem, Oregon, the Oregon Medical Board had already known that I was not masking, and neither were any of my staff in my clinic. And I was the only medical doctor who stayed open throughout the pandemic, while other doctors were hiding behind their desks at home and not even communicating with patients. So on that infamous day of November 7th, I actually told the world that I had treated COVID patients with 100% success, and they were all recovered, ready to go back to work in about a week's time. And a lot of people asked my protocol. I was recruited by the American Frontline Doctors, but I actually did not use their protocol because we did not have available to us in Oregon hydroxychloroquine, for one thing, and ivermectin had not come on the scene at that time. So what I actually used was a pulse dose of prednisone, 50 to 60 milligrams a day for 5 to 7 days, and that was to suppress the cytokine storm that was generated by the virus. I also used a high dose inhaled steroid, like Pulmicort or fluticasone, and I also treated them with an antibiotic that had antiviral properties such as doxycycline or azithromycin. And then for the flu-like symptoms, I recommended just a generic version of Pedialyte or something equivalent, an electrolyte replacement solution, and just take that until your flu symptoms subside, which is usually in about 2 days. And so, as I said, all my patients recovered. But when I spoke to the public on November 7th, the Multnomah County RNC actually took note of my speech, and they recorded it and made a YouTube video of my speech, and it went viral globally. So I was soon talking to doctors from Asia and Europe and across the United States, but also the Oregon Medical Board got a hold of it the following day, November 8th, and then on November 9th, the medical director for the Oregon Medical Board wrote me a bullying letter saying, you've got to get your act together and follow the dictates of Marxist Governor Kate Brown. And she apparently was to tell me how to practice medicine, even though she has no license. And so a short time later, I received a surprise visit from one of the investigators from the board, and he asked for 5 minutes of my time. I gave him actually about an hour plus of my time and explained to him that I was using the same cold and flu season protocol I had always used, and nobody in my staff in my office got sick. I treated all of my patients. I had a very safe protocol. I protected my patients from those who were sick by seeing them at the end of the morning session and toward the end of the day when all other patients had been seen. And it worked wonderfully. I would call my patients the next day and they say, "Hey, doc, thanks. I'm feeling so much better already. I feel really good compared to what I was feeling." And the bottom line is I did use a protocol that worked extremely well. And that was very disturbing, of course, to our politicians who had an agenda. Now remember, I spoke in November of 2020, and out came a month later the flu vaccine program. And of course, here's this little country doc from Oregon stating that, hey, don't worry about this virus. It's very treatable, easily treatable, when you can't have a treatment for emergency use authorization. And therefore, they took me down hard and fast. And I was the first medical doctor in the United States to have my license suspended. Then when I filed a federal lawsuit against them saying, hey, this is corruption, this is criminal what you have done to me, well, they do everything they can to not get into a real court because they do their damage in administrative courts, which is the quintessential kangaroo court. So they attacked me a second volley and tried to take me down for other means. And what they did is actually generated two false accusations and opened up two false fake investigations against me regarding pain medicine. And thereby said, see, since we've got this in addition to all the other stuff about not masking and so forth that they accused me of, they were able to revoke my license, and they gave me 3 weeks to respond, but I had been in Arizona visiting family, and I never got the information, and they said, tough luck. You see, due process is not a part of the process. And so I've got to answer the question, why do they actually go after independent medical doctors as I was? Well, first of all, because we cannot be bought off, at least if we so choose. We do not have to follow the narrative that the hired hand medical doctors do that are in the big hospital system. So they are very strongly trying to make us all disappear because we are just an annoyance to them. We're not a big group, but we do speak the truth and we remain faithful to our oath as physicians, and that was always important to me. My patients, I considered them to be my family, and I always did put them first, and I did no harm, and I healed every one of them, and of course, they did not like that. I was subsequently told to consider applying to the Florida Medical Board. In fact, I was strongly encouraged by an individual to do that, and so I did apply for a license in Florida. They turned me down, even though they swore there's no way I could get turned down. They did, because I had an open court hearing with the Oregon Medical Board. And by the way, my appellate court hearing is this Thursday, so we'll have to see what the outcome of that is. I won't be surprised if I am squashed again, and then hopefully onto Supreme Court with that. But I also, interestingly, I published an article in the AAPS Journal, the Association of American Physicians and Surgeons, and it was regarding COVID tyranny and the state medical boards, and that kind of got a lot of traction. And subsequent to that article getting out, I actually heard from a president of a state medical board, wrote me an email and said, hey, you know, I'm really sorry for what happened to you. I thought maybe, are you setting me up for something? But he wasn't. And he actually invited me to apply in his state. I won't give his name out right now because I just don't want to subject him to anything else. I found out that this position is genuine. He is a Christian man. He generally does care, genuinely cares about patients and about his colleagues, medical doctors. So that's an option that I'm now considering. But the real point in my short testimony here is that we need to realize what really happened with this whole corona mania, as I have always called it from the beginning. This is a planned attack against everyday people in America and worldwide to get them into a state of fear so that they can be controlled. And when people are controlled, then they can be oppressed. And then when they are oppressed, that always leads to death, and particularly when the government gets a hold of medicine, just as we saw in Nazi Germany. So I would just encourage us all to fight the good fight and to really strongly argue for the best evidence in medicine that we have. We must not collaborate with them. We must not shine them on in any way, but we have to keep speaking the truth as best as we can and expose the deaths that are happening as a direct result of a planned bioweapon that was marketed and that was patented well in advance before it was released and so forth. This is not an accident, is what I'm saying. And I take that very seriously. And I also did take an oath to defend my Constitution as a military man, and I retired Air Force, and I retired as Chief of Medicine with the Oregon Air National Guard. But I also was in the business of defending my country for a portion of my career, and I plan to continue in doing that. And I think that we really need to pull together to fight to save America, because we are in crisis right now.
You were truly a warrior. You are truly a warrior, Dr. Little. It's just amazing. You know, you touched on a couple of really important points. One is when you terrify most people, they will beg for tyranny. That's just the reality. And so they know how to play the game. They know how to control the minds of the masses, right?
That's absolutely true.
And so what you're experiencing, I find interesting as far as a lot of people might not know the full details, but when you're under investigation by a medical board in one state, other states are going to be very reluctant to license you.
Yes.
The fact that you've got a medical board, yes. So the fact that you've got a medical board reaching out to you saying, hey, we'll offer you a safe haven, I think that's pretty amazing, and it could be a national precedent-setting moment. And I'd like to say here today that if you're willing to do that, we would definitely like to help you finance that application and, you know, that whole operation, because I think it's so important. You know, if other medical boards are really willing to step up like that, it's a great testament.
I agree, and you know, you've got me thinking about it in a strong way. I've spoken with others, and all I keep hearing is please go for it, because you're right, it would set a tremendously good precedent, and also give us hope, you know, that perhaps there are some who will not sell their soul, because the great majority of those in medicine in any way have sold their souls. So yes, we must be strong.
Yeah, I think if the average person learned that you lost your license for effectively treating COVID patients, they'd be rightfully horrified, and they would do what they could to support your cause and, you know, expose that.
I would appreciate that. I will not stop fighting, that is for sure.
So the next speaker, Dr. Hardy Risch. Dr. Risch earned his medical degree at UC San Diego. Subsequently, he completed his PhD in biomathematics. Dr. Risch then completed a postdoctoral fellowship in cancer epidemiology at the University of Washington in Seattle. In 1991, Dr. Risch moved to Yale School of Public Health, where he became a professor of epidemiology. Dr. Risch has published more than 400 peer-reviewed scientific research papers, which have been cited by other scientists more than 46,000 times. He has a research H index of 102, is a fellow of the American College of Epidemiology, and is an elected member of the Connecticut Academy of Science and Engineering. Dr. Risch, it's a pleasure to have you on this evening.
Well, thank you. It's great to be with you and with all the viewers. I'm going to title my remarks tonight as 3 years to flatten the earth. I say that kind of sarcastically. We've been fighting a war for the last 3 years. And this war has taken on many fronts. Of course, we're fighting a war against this infection, but we've also been fighting a war against health, a war against the public, a war against information, a war against speech, and a war against truth. So I'm going to describe the pandemic in one easy to understand sentence. NIH and the Department of Defense funded dangerous, prohibited, gain-of-function virus research. The engineered virus escaped from the lab. The DoD claimed that it was a bioweapon, and it seized control to assert military, not public health management of the pandemic. Then DoD covered up the cause of the pandemic, suppressed early treatments, and forced this toxic, weakly effective vaccine, so-called vaccine, onto the population as a wartime countermeasure. that's not as a treatment, and without informed consent. And then hundreds of thousands of Americans subsequently died or got injured as a result. So that's the sentence. Now, let me expand on that a little bit. So here we have NIH and the Department of Defense. The DoD is working through its agency called DARPA, which is a major research agency within the Department of Defense. They funneled more than $60 million to the Wuhan Institute of Virology through the EcoHealth Alliance. We've all heard this, it's all been in the public media as far as we know. And what they did is all written out in a project called Project Diffuse, D-E-F-U-S-E. If you Google that, you'll get a link to the protocol and you can read it, and it says exactly how they did the gain-of-function research to make these viruses become human infective and toxic. Okay? And if you also, these groups published 2 scientific medical research papers in 2015, 2016, under the first author, Menachery, M-E-N-A-C-H-E-R-Y. And if you don't have to worry about the technical parts of the papers, just go back to the acknowledgement sections, the paragraphs at the end of the papers, where they say that even though these were done during the period that this research was prohibited by the government, they still nevertheless did it under approval of NIH. And we don't know if Dr. Fauci actually signed off on it or somebody in his direction signed off on it, but these were approved by NIH during the time that this was not allowed, not proper and allowable. Okay, so then this was an engineered virus, and we know it's an engineered virus because there's a long artificial strand of the genetic code of the virus that's so long that it could not have happened by chance and does not exist in any other organism among more than 100,000 organisms that are in NIH searchable database. It exists only in one other place, and that is in a patent from Moderna from 2017. There's no way that a patent sequence that so long could not occur by chance ends up in a virus unless it was engineered. Okay. And the function that stretch did is it gave the virus the ability to infect human lung cells. And that's what's called gain of function when you promote an organism to be able to be more toxic or more infectious. And so that's what it was. Then they claimed this was a bioweapon. Now there's various definitions of bioweapons, and this, because it causes human harm, could be construed as a bioweapon, but they militarized it, took the control away from public health, and that means that every action that has gone on underneath what we think of as all the regulatory, all the captured regulatory agencies and government really was underneath the control of the Department of Defense. And so we have to be paying attention to who is really controlling the narrative of this, and it wasn't even necessarily the government agencies that we think of as the villains, that there's a level above that, which is the Department of Defense. And then they covered all this up. They covered up the origin of the virus, and they did that, we know that, because of the so-called proximal origins paper that was published early in February of 2020 that was orchestrated by Tony Fauci and a number of virologists who had expressed the understanding that this was an engineered virus, to say, no, it wasn't engineered, it came from an animal transmission to human and could not have possibly been engineered, and so on. And this was, of course, a cover-up for the origin that was required, and Dr. Robert Redfield, who was the head of the director of the CDC in that period, has testified to Congress about this. And they covered this up because of what I refer to as the state-controlled media and the state-controlled social media and the pharma-captured FDA. All of this was covered up. They covered up and suppressed the efficacy of the early treatments like hydroxychloroquine and ivermectin and steroids, as you heard, vitamin D, and so on. These treatments absolutely provide significant, substantial benefit for keeping COVID patients out of the hospital and from dying. And the information on this is definitive. I've written a number of reports on this. The original papers are all in public domain, and it's easy to understand if you take the time to go through this. Okay. Then they called these vaccines countermeasures. When you're giving military countermeasures, informed consent is not needed. government approval is not needed. The fact that the FDA approved these things has basically been a show to create a theater for the public, to make it look like there was some semblance of normal medical function, when in fact these vaccines could have been inflicted on the population. Informed consent is not needed, and individual consent is not needed, and approval is not needed. None of this is needed under military countermeasures. So we have to address how much of everything we've observed was theater. Was it theater for the doctors on the review panels? Was it theater even for all of us who were the victims of all this? We have to be asking those questions. Okay, and then when it came down to actually using these vaccines, so-called vaccines, we even know already that they did not work to do what they were supposed to do, which is to reduce transmission, because the CDC even came out on August 11th of last year saying that the vaccine, the primary series, does not control transmission, does not control spread, and the boosters only work transiently and their benefit wanes. And for me as a public health person, anything that's transient and wanes is not a sustained public health benefit. So here we have it. We trusted scientists and the regulatory agencies who made a series of very bad decisions. Those decisions backfired, and the people involved both covered up their incompetence as well as believed that the outbreak was so bad that they had to rush with their supported cronies, the pharma industry, the vaccine industry, to push out a damaging product to the entire world in order to protect from what they themselves created through their incompetence. And the basis of knowledge of what these would do is reflected perfectly in Deborah Birx's famous statement about the vaccines. We hoped they would work. That was her degree of evidence. And so because of all of this incompetence and malfeasance, hundreds of thousands of Americans died unnecessarily, and hundreds of thousands more were appreciably damaged. Their health, they lost their health. And this was done to cover up the technically brilliant but common sense incompetence of the elite agencies and researchers who did this. So what we've learned from this is that naive people, and I include myself in that, who believe in the ideals of our American civilization, that even if our country is imperfect, we strive for equality, we strive for human rights, and we strive for increasing standard of living. And we found that, in fact, we're just another corrupt banana republic, just like all the others around the world. And I asked, where's our Congress been through all of this? Okay, there's been only one person in all of the Congress who has stood up reliably to push back on this, and where he couldn't push back, only to document what he could, and that's Senator Ron Johnson. And so where's everybody else? Where's, are they bought off by pharma PAC money? Or are they being threatened by the Department of Defense? Is Congress being threatened by the DOD? Is the FDA being threatened by the DOD? Is CDC being threatened by DOD? Where are these forces coming from? We really have a government that's been running amok, and even the new congressional investigations that we've been watching for the last week or longer, they really seem like theater, not like prosecution. Okay, this is a big problem. There's no point in doing a January 6th theater from the other side of the aisle. That's not what this is about. This is about finding the cause and the actors who did this and prosecuting their crimes against humanity. Now, I don't want to end up just on the topic of doom and gloom and all this, because I think we still have where to go in all this. We need to be organized to combat the nefariousness of what we've experienced. And I want to say that the natural urge is to protest, to go out, organize, go on the street, lobby in front of governments, write op-eds, and all of this stuff to protest what our government has been doing. And for those of you who followed in the non-state controlled media, you know that there have been hundreds of thousands, many hundreds of thousands of people all over Europe protesting, the truckers protesting in Canada and so on. And this got almost nowhere. That all this did was make people know that they weren't alone, that there's lots of people who believe and understand the evidence the way they do, but the government, all the governments have just been laughing at this and basically saying, we're gonna do what we wanna do, and the only way that you're ever gonna stop us is to find an arm of government that will follow your values, and the only one that's left to us is the courts, and even that has been difficult and challenging, but there have been some successes. So I want to say that our approach should be not that, but basically to throw sand in the gears, and that is not comply. You have to stand up for your own values, for what you think is right, what's right for you, and what's right for the country. And in order to do that, everybody needs a plan B. That means you have to be prepared for the consequences of how you stand up. So if there's a risk that you'll lose your job, then you have to have lined up some alternative way of surviving under the circumstances, some independent way of flipping into that, at least for some temporary period. Because if 1 or 2 people in a hospital quit because of vaccine mandates, it won't do anything. But if 10 or 20% of the nursing staff quit because of vaccine mandates, the hospital will come to a halt. Hospitals cannot function like that way. Pilots, if 10 or 20% of pilots refuse to be vaccinated, the airline industry will come to a halt. You need to have large numbers of people who understand that the only way to protest is to protest with their own actions and not in the easy ways. It's very easy to go out and protest on the street by yelling and having speeches, and the speech that I'm giving now is very easy to make too. What's necessary is to stand up and block as much as you can through your own actions, through your own legal actions, what you can do to interfere with the process that's been running around suppressing our constitutional rights. Okay, now I'll say that we have been given some gifts in this. That the first gift is that virus is gonna virus, as they say, and ultimately the virus seeks to optimize its way of infecting a whole population, and it does that by making people mildly ill, not very ill. If you get very sick, you stay home and you only infect your family members. If you're mildly ill, where you're only coughing and sneezing, then you tend to go to work. You're out there in the public, and so you can infect both your family members and everybody you interact with. So viruses don't want to make people too sick. They want to make people just right sick so that they infect as many people as possible. And that's in fact what we got with Omicron, which is when the emergency ended. Because Omicron is an annoying, obnoxious kind of illness, flu-like illness to get through. I've had it, I can speak to that well, but it's not generally a life-threatening illness to almost everybody who gets it. And for the people who are really at serious high risk of doing poorly with Omicron, there's, as we said, medications and treatments that can be used to keep those people from getting hospitalized or dying. Nevertheless, Omicron was a gift to us. The second thing is that the current variant that's spreading, the XBB.1.5 variant, has been around for quite a long time, and almost nothing is pushed it out, which makes me think it's getting close to the optimal virus for the population, which means that people are going to end up getting very immune to it, and that means the virus itself is going to go down in prevalence. Now, I've seen the CDC says that XBB.1.5.1, which is an offshoot, may be pushing back. We'll have to see. That's going to take another 3 months to know, really, or maybe less. But in any event, I'm very optimistic that we're in a much better state now with this infection than we've been at any other time. And finally, there's one other gift that we've gotten from this, and that is that these repurposed medications that we've been speaking of, hydroxychloroquine, ivermectin, the steroids, like the oral and inhaled steroids, vitamin D, zinc, vitamin C, and other things, these medications likely also work for other respiratory virus infections. And I've had a number of colleagues who told me that they've been using them for their RSV infections and for flu infections, and have had very good success with these repurposed and over-the-counter medications and supplements. And so I'm cautiously optimistic that we will, over time, develop more knowledge that respiratory virus infections can be treated starting very early during symptoms, can be treated by these and other approaches. There's also nasal sprays and mouthwash, gargles, and so on, that will suppress the virus and suppress serious consequences of the virus. So I'm very optimistic about where we're going with that also. Well, let me just finish by saying that it's well known that the Soviet dissident Nakan Sharansky said that under the USSR totalitarianism, 30% of the population disbelieved the government but could not speak out. And 30% of the population were what we call useful idiots and supported the government and were happy to be part of the game plan. And 40% in the middle kind of didn't know what to believe or not, but still couldn't speak out either. Here in the West during the pandemic, the 30% of the population has not believed the government also, and not gone along with the diktats of the public health infrastructure administration. And I think that for me, many of us were scared just like everybody else over the propaganda that was dumped on us wholesale and continuously for all of these 3 years. Nevertheless, we still recognize that something was amiss, used our brains and our critical thinking to decide for ourselves that this was not right, that this was propaganda and not truth. And in spite of being afraid, we went on our rational considerations rather than our emotional fear considerations, and that's crucial. And so you have to remember, we are the 30%, and we are not going to be silent. We speak out.
That's right. Name it up.
For the last 3 years, trust the experts. Well, you are the type of expert we'd like to trust. So thank you for being brave. So as I said earlier, this is our 10th COVID Truth Town Hall event. And typically at the beginning of our events, I put up about 10 slides to bring people current as to the latest, the latest insanity. And one of your news pieces, July 27th of 2020, you wrote in Newsweek, "The key to treating COVID-19 exists. Why aren't we using it?" So I'm asking you, was that one of the big wake-up moments for you when you realized treatment exists, it's being suppressed, what is happening?
Yes, what happened was when I published a paper in the American Journal of Epidemiology at the end of May 2020 on hydroxychloroquine, then I started getting reporters saying, "Oh no, don't you know that it doesn't work?" and citing these various studies that were pushback, except that I was reviewing outpatient treatment, so for people at high risk, who have older age or chronic conditions that put them at high risk. And I was looking at treatment starting within the first 5 or so days of symptoms, and they're telling me about where this wasn't effective in hospital patients, and this is totally irrelevant. And so I said, well, I'm used to reporters being incompetent. I had that over 40 years of career reporting on my cancer research. So when this happened, at first I thought this was just more incompetence, but I gradually realized that this was systematic. And therefore, there was an agenda being pushed here, coming from above somewhere, and this really became more obvious after I wrote the Newsweek essay. And really, the bottom line is, in the middle of the pandemic, when you have no other treatments and there's no opportunity cost, all you have to show is something is safe. You don't have to show that there's efficacy. You don't have to prove it with multiple randomized trials. It's good if you have some evidence that it's beneficial. But the fact that these medications, and ivermectin later on also, has been used in tens of billions of doses in hundreds of millions of people for more than half a century, that is absolute evidence of safety, that doctors feel free to use these medications all over the world without doing EKGs, automatic EKGs on everybody, without, they follow good medical practice, standard of care for other illnesses like rheumatoid arthritis and lupus, and malaria prevention, which was the main usage that it was used for, called Sunday. It's over the counter in much of the world, especially in Africa. And so these are completely safe medications. And the fact that this was claimed to be not EUA-able unless you came with multiple large randomized controlled trials was irrelevant and insane, and violated the 20th Century Cures Act, which was passed in 2016, which says in section 3022 that regulatory agencies shall investigate all types of real-world evidence as well as randomized trials in support of their decisions. I mean, it's a little bit more convoluted writing, reasoning in there, but that's the gist of what it's saying. So this was all a campaign to push back, to suppress these medications. CDC put out FDA put out a false website claiming that these medicated, that the outpatient use of hydroxychloroquine was dangerous for cardiac rhythm issues. And then in the small text underneath, it says we base this on one study of hospitalized patients. And this is telling you immediately that they had no systematic data on outpatients, because they would have cited the outpatient data if they had it. So this is all a big lie. That website is still up on the FDA's website. It's a big lie, and they're still hiding behind that lie and getting away with it, because I seem to be the only person around who's making the obvious statements. Just read what they say, and it's so obvious that it's a lie.
Truly amazing. So early on during our town hall series, by talking to people and realizing what was happening, we realized we basically only have a few brave doctors here in Delaware. So we used the FLCCC protocol and did our own research and came up with our own over-the-counter kit, because basically we realized people are going to their doctors. The doctor says, if your lips turn blue, go to the hospital. Sorry, you've got COVID. The government's telling you to test, but I can't do anything for you. Well, these people would be absolutely terrified, as we know. So we created a kit, the basics: D, C, zinc, quercetin, Pepsid, Zyrtec to shut down the cytokine storm. And it's amazing. I guarantee we gave our kit out hundreds, maybe even thousands. I don't even know. It's hard to say. Personally, I spent thousands of dollars at Walgreens and a health food store packing these kits and giving it to people. And then we shared them, the photograph of our protocol. And it's amazing. I can say that I don't believe anyone who used our kit ended up in the hospital. And that's because there was such a vacuum of practicing doctors. It was just a crime against humanity, one of the many, right?
That's right. And you quickly know and learn that viruses are treatable, but not by single agents. AIDS isn't treated by a single antiviral. Antiviral treatments require multiple agents that clobber the virus from multiple pathways. And that's what we've done through these regimens, that both yours and the ivermectin hydroxychloroquine regimens, they're not just single bullets. They have to be used in combined regimens, and they work exceedingly well.
Absolutely. And there's a point that you made that we've also shared at our events, and it's just so important. As you know, if one or two people stand up, it's very easy to pick them off. But if people could really start standing up together, it's just so simple, right? You join forces, stand up together, and break the machine. And then
That's right.
And then the machine will beg for you to return, and you might even get a raise. Well, thank you, Dr. Risch. If you're able to stay around for the Q&A, we'd love for you to. The next speaker we have this evening is Dr. Mary Hoser, PhD. After attaining a bachelor's degree in chemistry, Dr. Hoser received a PhD in microbiology and immunology from Wake Forest University with a focus in molecular virology. Her work in virology and immunology has involved studies with multiple virus families and contributed to the understanding of virus-host interactions, including viral and cellular determinants of innate immune pathways, as well as structural changes of replicating viruses. Dr. Hoser currently directs evaluation of preclinical immunogenicity and efficacy of multi-antigen virus-vectored vaccines at a small biotech. Hi, Dr. Hoser. Nice to see you this evening.
Hello, thanks for having me. I want to first thank Delaware Medical Freedom Alliance and UGRAX for tirelessly standing up for the last 3 years and advocating for medical freedom. So thanks for having me here today. So as my background indicated, that was a mouthful. I didn't realize till spoken out loud, but my training has been in both learning about viruses, that's been my career, and then it's more recently intersected prior to COVID into a vaccine biotech focused on highly lethal pathogens like Ebola viruses. So my perspective has been unique throughout the outbreak, but I will say from the very beginning, everything smelled off, and I've been dissenting from the beginning as well. So my talk to you guys today is going to cover several points. I'm going to feature SARS-CoV-2 as the virus and follow up on a little bit of what Dr. Risch said about the gain-of-function features and now how the virus is an endemic cold. And then talk to you a little bit about vaccine platform technologies to help your audience understand the differences between vaccine types. I will touch on spike cytotoxicity, so that is the antigen included in the vaccine, and then finally wrap up talking about the importance of individual liberty. So Dr. Rich did a great job highlighting what the advanced features are of this virus. I'm going to share my screen because the picture is worth 1,000 words, and it's disabled at the moment. If that gets enabled, I'll show some pictures. But there were features in the virus where there was an addition that wouldn't occur naturally over the course of evolution. So it was clear to people in the field of viral evolution that this was not a natural post-species jump. And the changes in the virus allowed it to become more infective, as Dr. Brish stated. But now the virus is seeded, the outbreak has happened, and the virus is there. And viruses naturally evolve to be less pathogenic and more transmissible. They want to make more of themselves and not kill their host ultimately. So that is also highlighted if you pivot over to highly lethal pathogens like the Ebola viruses. You can see that those outbreaks die very quickly. And that was evidenced through the recent Sudan outbreak, and there is an ongoing Marburg outbreak that appears to be dying out as well, totaling on the order of hundreds of deaths. What we saw after the virus was seeded, this coordinated global response, and we saw a gross overestimation in mortality estimates. So those were overestimated and reevaluated by Dr. John here. Let me see if I can share my screen on his data. So the actual infection fatality rate is generally somewhere between 0.5 and 1%. Early in the pandemic, we were told 7 to 10% mortality was the estimation. So it was grossly overestimated as an excuse for lockdowns and authoritarian policy. I'd also like to highlight that most of the mortality did occur in comorbid people with a lot of other diseases, or in the elderly. I'd like to highlight that children have a negligible risk of severe COVID. And this is really important because the vaccine has been pushed on children so heavily, and they were accused of spreading the virus, and this led to schools closing and the horrific masking of our children. So now SARS-CoV-2 is an endemic cold. Similar to other coronaviruses, we have human coronaviruses that are already in circulation for many, many years that have caused seasonal colds, and we have no vaccines that are effective against those. So it was very clear that there was a coordinated global response, and this virus was being exploited for the purpose of policy and not health. Now I'd like to get into a little bit about vaccine technologies. Traditionally, what we've seen come out of the vaccine pipeline have been inactivated whole killed vaccines that are down here in the purple, or more recently recombinant protein, and then even more recently the genetic vaccines of DNA, RNA, or viral vectors. So the current vaccine campaign was based on messenger RNA. And that RNA is a code for translation of the protein of the target pathogen. And it was manipulated so that it was highly stable. Normally, RNA will be degraded in the cells and go away rather quickly. The life cycle turnover is fast. But this vaccine was engineered with multiple elements that caused a high rate of stability, so it sticks around in the cells for a very long time. So coupled with this messenger RNA is the delivery vehicle of lipid nanoparticles. Lipid nanoparticles are basically just a fat blob that gets the RNA into the cells, and it can stimulate some host cell responses to get the immune system going. The problem with lipid nanoparticles is they're widely distributed throughout the body. And we saw that first through the Japanese regulatory documents exposed by Dr. Brittle in Canada. So these LNPs don't stay localized to the site of injection. They go all over your body and accumulate in adrenal glands, the spleen, the ovaries, and other tissues, and even cross the blood-brain barrier where they're not supposed to be. And remember that they're coding for the target antigen that you're training your cells to attack against. So we do see disease with the vaccines, and that is attributed largely to the spike protein, which I'll touch on in a minute. I wanted to state that the rapid rollout of the vaccines added selective pressure in the state of viral evolution. And that was evidenced in a San Francisco study. If you just focused all the way to the left here, on the top, fully vaccinated people have a high red block here of antibody-resistant virus output, whereas unvaccinated people had a much less percentage of antibody-resistant virus present. So it was clear that the vaccines were forcing mutation of the virus even further. I'd like to also touch on the expedited regulatory path that was driven by the rapid response and operational warp speed by highlighting what the normal development time for vaccines is, which is 7 to 10 years. So normally, a vaccine development would go through all these phases of animal studies, then human clinical trials over the course of 7 years, and finally approval after vetting safety and efficacy. With these vaccines, they tested in the animals at the same time as they rolled out into humans. So we had no idea if there would be adverse responses like antibody-dependent enhancement. It was already in people. The rapid rollout also led to contaminated vaccines. We saw in Japan a large number of vaccines were recalled for metal contamination. And more recently, Dr. Kevin McCarran has done deep sequencing to reveal a large percentage of contaminatory DNA from the manufacturing process that still poses an unknown risk. And finally, these vaccines were not just offered to the public, they were heavily coerced onto all the populations, including children who did not benefit from the vaccine. And they were mandated for others, as you've heard today, and people have lost their jobs and their livelihoods for not complying. And kudos to you for holding the line. If we pivot a little bit into spike toxicity, I'd like to just highlight two things. Studies have shown that the spike protein causes heart damage, and this beautiful paper showed signaling and how it all occurred. But the spike protein is a toxin that causes heart damage, and it's been implicated in amyloid fibrogenesis. And formation of amyloids are a causative factor in neurodegenerative diseases. And I also like to parallel long COVID to vaccine injury. So we do see some of the same features in long COVID scenario, which is very vaguely defined at this point, as well as with vaccine injury. What I believe is happening there is in both of those patients, you're having an elevated expression of the spike antigen for a very long period of time that is end up causing disease. The important factor here is that in a healthy individual, this will not happen, but the vaccine will force you into that scenario in a healthy person. Importantly, there are treatments and more holistic providers out there, like those on the call today. I would encourage you to resource doctors outside of the medical establishment that are still fully trained but focusing on overall health and wellness, your diet, exercise, and your metabolic wellness. And some examples of those are the wellness company or the COVID critical care doctors as well. And finally, I just wanted to wrap up and highlight that yes, there may have been gain of function research that our government funded, as Dr. Risch also pointed out. It was not only the DoD, but it was also the NIH that funded Eco Health Alliance. And I have read through the documents that define the gain of function research that was done. But are we gonna rely on the organizations that perpetrated the crimes to hold themselves accountable? I wouldn't count on it, and I would pivot back to putting sand in the gears, like Dr. Rich said. And you can do that through exercising non-compliance in numbers. Small ripples make large waves. What you do has an effect on other people. So I encourage you to stand up against the machine in non-compliance. Exercise bodily autonomy, right over what you put in your body and what you put on your body. And personal responsibility for your own health, not relying on the pharmaceutical industry. And finally, self-sufficiency. We need to get back to the basics and learn how to grow our own food and have our own energy source and form strategic local networks. So, thank you.
Thank you, Dr. Hood. Wow, that was a full spectrum breakdown that we all very much appreciate. You mentioned a lot that I'd like to cover, but I don't want to take up too much time. But there's definitely something important that I think is definitely worth mentioning as far as the small ripples becoming large waves. At our first event on June 7th, 2021, we actually had about 10 speakers, and one of them was Dr. Robert Malone. And we discussed the mRNA technology, and at that point we had the Japanese study that talked about the full systemic biodistribution of the lipid nanoparticles. And we told him, hey, you know what, these shots are bad, we know they're bad, the science is there. And he did a great presentation on bodily autonomy, the Belmont Code, the Nuremberg Code. But he said, you know, be cautious, stay away from the science of the shots, you're not going to win that argument. But I'll tell you what, we're not backing down, we know that we've got the argument won because these shots are evil. So thank you so much for everything you do in your day-to-day life, but also thanks for the presentation, that was truly amazing. And yes, the best way to nullify tyranny is just say no. The next presenter we have this evening is a very interesting character. So Scott Miller is out in Washington State. He's a former pediatric PA. He's treated over 3,000 COVID patients. He's an advocate and whistleblower for patients in prisons and hospitals. He was the first provider in the U.S. to have an emergency suspension of his medical license for prescribing ivermectin, writing mask and vaccine exemptions, and aggressively advocating against the use of experimental poisons on our population. So the common denominator between him and Dr. Latula is that they both lost their licenses for doing the right thing, and that is a very disturbing trend in the land that we thought was free. So Scott Miller, welcome.
How are you?
Doing great, man. Thank you.
It's good to be here. Now I have a question because you had sent me a list of some things. Did you want me to did you want to Q&A it or?
I say, tell us your story, man. Your story is unbelievable, but we know it's real. So give us the shot from the beginning.
I'll try to be brief. Sorry. I had a single provider, privately owned pediatric practice in Southwest Washington, just over the river from Portland. And in November, December, January of 2019, 2020, I recall seeing just a lot of sick adults, like moms and dads that are bringing their kids in and they'd go to the hospital, especially in say like February, March, they'd go to the hospital, they'd go home with, a Z-Pack and an albuterol nebulizer, inhaler. They bring their kids in, it's like week 2 and they're just coughing and they sounded horrible. And let me listen to your lungs and I do a neb treatment of albuterol in the office and there's no improvement. And I remember one gentleman who had asthma and I was like, let's do some budesonide. So I had him do a round of budesonide while I was doing an exam on his child. And he said that he just couldn't fill his lungs. He felt like just couldn't get a full breath in. And a couple minutes in, he was like, wow, I feel like I can breathe. And I was shocked. I'm like, really? Like, this is a maintenance medication. And so he also had allergies, so I put him on, I sent a prescription for budesonide and then montelukast and ciprofloxacin. And it was either the next day or 2 days later, he called our office and said that this horrible cough that he had for 2+ weeks was gone. And I just remember thinking that was odd. And then, we kept hearing more and more about COVID. And then I started doing trials on parents with some of these different regimens. And I kept hearing good things. And then everything shut down here in Washington on March 12th on my birthday. And I did not understand what the heck was going on. We've never seen anything like this. And then Fauci started saying there are no treatments, and that made no sense to me because that's impossible. And then 3 days later, I came across. So I just started studying. I was going through everything I could from China, Italy, etc. And I came across a paper on. It was like a blueprint of the virus, but it was also talking about melatonin and melatonin's inhibition of inflammasomes and NLRP3 and caspase-1 and decreasing interstitial fluid leakage and infiltration of neutrophils and macrophages into the lungs. And I'm like, I don't know what I'm reading. I don't know what inflammasomes or caspase-1 is. And I didn't translate on it because it was out of Italy. So I'm like, and it was probably 2 or 3 in the morning. And I just thought, this is incredible because I'm going to spend, I spent the next 6 months studying some of the, I didn't know what virions were. I didn't know what OR3 was, right? It's like, I have no clue what this is. So I started watching MedCram videos with Dr. Schwelt and came across the ivermectin study out of Australia on April 3rd or 4th of 2020. And I was like, well, I've used that tons in kids. It's super safe. Well, why don't we try it? So I used, I think it was April 9th, I used ivermectin for the first time. It wasn't by itself. I was using, I did some of the other, like high dose. So I was telling everybody vitamin D, right? Like we live in Washington. Our vitamin D is already shot. We're not going to make any until, we start making it in March. But so I have a list of vitamin D, vitamin C, zinc. I was recommending fairly high dose melatonin if people tolerated it, if they got sick, and low dose for prophylaxis. One of the questions was, why weren't kids getting sick? Like the studies in China was like 9 and under or 10 and under, it was a 0% mortality rate. And I'm like, that's intriguing to me. And so I start looking at melatonin, and it's like, if you're over 75, I think the average picograms per milliliter is 29, and for a 1 to 5-year-old, it's 325. I'm like, that's crazy. And then I realized, wow, melatonin is one of those potent, immunomodulating, substances we have. And then studying about the H2 receptor and the proteases needed to cleave spike, the S1 component. And again, children have a lot fewer of the H2 receptors, et cetera, et cetera. So when it came time to go back to work after they shut the country down, I remember my wife asking me, she's like, are you allowed to go to work? And I'm like, what do you mean? She's like, do you need to call somebody? And I'm like, I'm a sovereign American. Like, the only person I need to ask is God if I can return to work. It's my office. I get to choose what I do. And just like with Steve, I think I was the only one, at least in Southwest Washington, but that never closed. And I never masked. I didn't make anybody in my office mask. I used universal precautions like washing our hands and covering their cough. And I just started seeing when the school shut down, just each step that they were doing was a further step into madness in my brain. I just kept like talking to people like, what is going on? But the fear factor was just raining down on people, and they're watching every news station has the death ticker, and it was just absurd. So I was seeing the very negative impact on children. Especially because I had a pretty large special needs population. So when all of their speech and PT and OT, et cetera, are taken away, and mom or dad are having to stay home, and it was just a dumpster fire of I would just the rights that were taken away from children in this are so horrific. And I started speaking out about it, and I was encouraging parents to break the COVID law, where they would say, well, we haven't been with friends for 6 weeks, or we just want to go to the park, but parks are closed. And I'm like, parks aren't closed. There's like a yellow ribbon going over it. Step over it. Step over the chain. And so I started writing prescriptions on triplicate form. I'd write a prescription for the mom, I'd hand her the prescription, go to your friend's house, have their kids come out and go play. And I remember I would get pictures from, everybody has my cell, so I'd get texts from these moms showing their kids holding hands with the neighbor kids, and I'm just let's disrupt this. And then I was asked if I would speak at a freedom rally in Olympia in May of 2020, which kind of started my downfall. And after that, I got investigations began on me. I was asked to join a number of local Facebook groups to reopen our schools, and I was just trying to get the information out there as much as possible. There are treatments. Treat early, treat aggressively, and one of the gals in the group reached out to a local reporter who asked if he could do an interview about kids going back to school for the fall of 2020. And the interview, when he came to my office, I asked if he knew what the treatments were, and he's like, no. And I'm like, it's September of 2020, or how do people not know what the treatments are? I couldn't. And so it ended up being an article about how the successes that I was having treating COVID, and it published the next day, and our phones just went nuts. And yeah, it was shocking. The complete inability for anyone to get any kind of care, and then what they were told to go home and take Tylenol to further balm their liver and decrease glutathione stores when you need it the most in this type of bioweapon attack. And then word just keeps spreading. I got together with local pastors in churches, kind of what you did, where I had my protocol list and all of the vitamins, supplements, because I was just giving them out, and I was spending thousands of dollars a month purchasing supplements and the time bagging them. So we had churches that were using some of their funds to buy just buy the supplements, and we set up kind of pods around our county to cover different areas, because it's a fairly geographically a large. The people that were calling me, there were times where they were at the point of calling 911, and so we needed to get things as quickly, to them as quickly as possible. Which was amazing, the way our community came together to save lives. It was because these were people that had a headache. They were standing in the low 80s, 70s, sometimes high 60s. So they were requiring care fairly quickly, and they did very, very well once they got the necessary thing. So, anyways, I was asked to speak at a school board meeting, not realizing how politicized they'd become. I was in May of 21, and by that time I had treated enough people, and their turnarounds were so quick that I was comfortable. And these were, again, multiple comorbidities, high risk people. But when I started adding, adding in, I was doing dexamethasone initially, and I switched to methylprednisolone, which has much better lung penetration. I was doing higher doses. I was doing budesonide more frequently. I was increasing it to 1%. And anyway, so when I spoke at the school board meeting, I called the school board either ignorant or pure evil for, they either have the data and they're doing this purposely, or they don't know the data and they're ignorant and we need to educate them. And a local reporter wrote a hit piece on me. And after that, I started getting like email substacks of complaints from the medical board or the medical commission. So I had my first complaint in August of 2020 accusing me of lying on my initial license for an application for my medical license. And then, I opened my inbox and 13 complaints. I was like, oh boy, this is, and it was all, we read an article about, this PA and he needs to have his license suspended. Which I'm like, they don't have any grounds to do it. Ivermectin wasn't illegal at the time. So and that article reached a lot of people that started calling us asking for help. So anyway, so it just kept going and going. And, when the rollout of the vaccines happened, the shots, things changed. And I could be way off. It was like the jab was Delta, because things changed so quickly. And for me, in like March or April of 21, the things that I was doing were working. The COVID brain was getting significantly worse. The dark thoughts were getting worse. The cytokine storm, that day 8. Cytokine storm was really crippling people, and my wife was asking me, she's like, Scott, how come she would hear people calling and they'd been on the treatment for a couple days and they're barely able to speak, gasping for breath. So I had to kind of go back to the drawing board, and that's when I started using colchicine, using the standard, but adding in azithromycin, adding in colchicine, adding in famotidine, hydroxyzine. I started having people nebulize acetylcysteine, hydrogen peroxide. I would make up a mixture of things for people to nebulize. And it worked. I started getting calls because, when your dad's sick and you get better, and then you have the family member going to the hospital, they're like, can you call an advocate for a family member? And I'm like, well, sure. Again, I had done it a couple times in 2020, and it didn't really get anywhere. But locally, when I started doing that, I thought, because the first time I did it, we were actually able to get a hold of the on-call doctor. She wouldn't stop the remdesivir, but we got him off lisinopril. They were about to put him on a ventilator, and he's on 6 of dexamethasone. So she switched it to high-dose methylprednisolone, and he had bilateral bacterial pneumonia. So she actually treated him with Rocephin and oral doxy, and put him on moderately, put him on 80 milligrams of methylprednisolone Q8, and the next day he was sitting up eating. 2 days later, he's up walking around, and he ended up going home. And I was like, wow. I had a really cordial conversation with the daytime doctor, who was intrigued at his turnaround. And that was probably one of the last, what I would say, cordial conversations I had with the hospital. And I was horrified at what I was hearing coming out of these intensivists and pulmonologists' mouths when they had a patient that was decompensating and they're on supplemental oxygen, 6 milligrams of dexamethasone, and nothing else, or remdesivir, and we'd try and plead for them to stop giving the remdesivir, and they would say, well, we finally were able to get that to happen, but early on we were having a difficult time getting these doctors to discontinue remdesivir, or then they would add baricitinib, which was just almost worse. So it turned into even more contentious, I guess, where, I mean, not from our standpoint, this would be the family member and me, and we're just politely but persistently, almost at a certain point begging. It's like, we'll send you the literature, we'll send you all the research. The patient is asking, can I please get these medications? And it was never ivermectin because the hospitals took it off their formulary, so they couldn't give it. So I never even asked for it because it shut down too many conversations. So I always went with just, can we add budesonide? Can we add montelukast? Can we add melatonin? Can we add thiamine, right? Like some IV thiamine, cipreptidine, famotidine, and there were times that we could get that, but a lot of times they're just like, nope, we can't nebulize COVID. And I'm like, I don't even know what that means. Like, that's the dumbest thing that they'd be saying, and I kept getting more calls and advocating, and the nurses started reaching out to me, letting me know that it was not welcome. The doctors were not appreciative of having somebody ask them if they could change up the protocol that was obviously not working. And I finally had a patient die. 77-year-old woman lived by herself, and she woke up with new onset chest pain and back pain. I thought she might be clotting, so I sent her to the ER to get imaging and lab workup, and they convinced her to stay for monitoring, and she never left. And I promised her, when she was crying, saying she didn't want to go to the hospital, that's where people go to die, I promised her, Rosemary, nothing is going to happen to you. I will not let anything happen to you. You're just going in for imaging. You're going to be fine. And they killed her. And I ended up writing a lengthy piece about what was going on in our hospitals and how they weren't making errors, they weren't making mistakes, they were actively letting people die. We're actively, I call it, killing them. And I named the doctor, anyway, so yeah, just things it started spiraling. I was getting more and more attacks. I was asked to speak out more and more, and I had just done a local county kind of health fair where I was speaking about what do you do if you go into the hospital, pre-hospital, like have your power of attorney, make sure that you have, I don't care, like write it on your chest, write it on your arm, like no remdesivir, no ventilation, just how to advocate the best you could, make sure that it's a hospital where they allow outside things to be dropped off, right? Or outside food, outside beverages, something, because we had to find a way, if the doctors wouldn't, we had to find a way to get something into them. I got COVID in October of 21, and got over it in a couple days, went back to work, and there was a packet waiting for me with a summary emergency suspension of my license. So I had just opened up a portal for monoclonal antibodies. Unknowingly, my license was suspended 3 days prior. I just hadn't been at the office. And so I got a friend of mine, a colleague, for us to be able to use her credentials, and we had a number of nurses that were volunteering with me, and we turned the clinic into a monoclonal antibody infusion center and started getting pretty large, like we could get a lot of the Regeneron, and so I was simply consulting, but we were able to treat hundreds and hundreds of people, and it's through because I had an empty office, and so each time we would do something, more complaints would be filed, which obviously made the nurses concerned. So that ended the monoclonal. And I wrote a lot of mask exemptions and vaccine exemptions, My goal is to at least keep the Christian schools open and in person. So I wrote hundreds and hundreds of mask exemptions for specific schools, so that the principals could keep schools open, which again, it just, I kind of went against what Washington State's public health policies were, and so they considered me on one thing I saw the most dangerous man in Washington, and I'm perpetuating the spread of a virus during a global pandemic. And my words are because of the following, whatever, because I wasn't, let's just say I was not advocating for people to get inoculated. And yeah, I was begging parents to just pull their kids out of school, like don't do home, distance learning, just unenroll them, take the school's funding away, let's defund these institutions. And that's what Dr. Risch was saying, we've got to take their power away. So yeah, it's been a real, it hasn't been boring. The other aspect of the pharmacies, the way they got into the pharmacies were so corrupt also, where it wasn't just hydroxychloroquine or ivermectin. I had pharmacies that, I had a pharmacist turn me into the medical commission, because, and refused to fill any medications, period. She would fill budesonide, she just was like, he's under investigation, and I refuse to dispense any medications. Or I use amantadine, which is an antiviral, and I had a pharmacist saying, well, that's used for Parkinson's. And I'm like, okay. And he's just like, I'm not going to dispense it. I'm like, isn't that practicing medicine? I don't know that you can make that judgment. So, yeah. I mean, there's a lot more. I just don't want to bore anybody.
It's an amazing story, man. It really is. Truly unbelievable.
So, go ahead. Go ahead, Erasmus.
So we had talked about some of your investigations as you go over patient charts, hospitalized patients who ended up dying supposedly of COVID, but more likely they were actually murdered by hospital protocols. It sounds like Dr. Latula were working on the same concept. Can you tell us, have there been any successful lawsuits proving that to be the case, proving malfeasance? What is the actual angle, and has there been any success there?
Not that I know of, and it's really hard. So I'm working with Former Feds for Freedom, the COVID Betrayal Project, and the COVID Widowers Group for Justice. And I've gone through a number of charts, and because of my case and going through what I've seen, when you look at, so there's a few things that I think need to be looked at, because unprofessional conduct. So first of all, anyone that's lost somebody in the hospital, they need to go through that chart and file a complaint on everyone that had any interaction with their loved one, right? If we don't, I have over 100 complaints on me, and only one is from a patient because we weren't wearing masks, which I'm okay with. I'll take that complaint. And mind you, complaints cost a lot of money, so a lot of time and money, and so we need everyone to start writing in complaints to these hospitals against doctors that are, and I hate saying it, but these are doctors that actively refused care or actively gave. If you're giving remdesivir in 2022 and 2023, hell, we all knew it was bad from the beginning. But if you're giving it in 2022 and 2023, that's malpractice. You should not be practicing medicine, right? It's just so. Like we have to go after, and I think we have a few. I'm going through one right now where the story is just, it's so bad. When we lose 45, they're starved to death, right? They don't give them nutrition, but I can't go into it too much, but what they did. There was absolute things that they were not supposed to do. And then, the wife had been in the room and walked out for just a second, like they were gonna put a PICC line in. She walked out, and when she came back in the room, he was on a ventilator. Like, what the hell? That's it. I mean, that's insane. That's absolutely, like, and the thing is, we know, like, you talk to them, it's like, what's the percent likelihood that they're gonna, like, get out of the hospital if they've been put on mechanical ventilation? Or, like, I've only gotten I've gotten 3 people off of a ventilator, and they're still, like, they still have some complications from it. It's very damaging to do that. So they know that the likelihood is 6-10% at best, and that's if they don't continue to actively kill them with the amount of fentanyl and propofol and paralytics. They just work them out of their mind. It's so maddening. So I think that if we can get people, intensivists or pulmonologists, to look at the amount of medications, the combination of medications, the paucity of medications that are being given towards the end, where they'll do a 10-day course of dexamethasone and then they stop it, right? So even though that's not very much, it's still helping keep some things at bay. Or they go in and it's severe sepsis protocol in the ER, and 104 fever for 3 days, and all of a sudden they get chest x-rays back and it says COVID pneumonia, right? But when, like, even early on, when you look in China, like 64% of patients they were having had ground glass plus the opacities. I mean, and they were using antimicrobial therapy or antibiotics on 100% of their patients. We're using it on none. Not none, but so few. Like, I had to beg doctors they're like, well, it's COVID pneumonia. I'm like, ever had like influenza, and then they come back like 5 days later and they have a secondary bacterial pneumonia? But they went, like, very few times would I see cultures where, it's just where it would take 5-7 days to get the culture results back, and they just wouldn't put them on antibiotics, as their white blood cell count and procalcitonin are just climbing, and it's so horrible.
So here's a question for you, Scott. I think what a lot of us have a hard time believing is that hospitals would intentionally kill people because, historically you go to the hospital to get well. So we're told that you get the hospitals receive a 20% bonus for putting people on remdesivir. And as I'm sure you're aware, the VA did a study of 2,600 COVID patients, and they said that remdesivir is known to cause extended hospital stays and not contribute to survival, and also cause kidney and respiratory failure. So we know remdesivir is toxic. And then there's also something that's supposedly hospitals receive a $39,000 bonus for putting people on a ventilator. So my point is that clearly there is a financial incentive for hospitals to put patients on these dangerous protocols. But what I can't figure out is what inspires them to hit the lethal injection button at the end, where they just ramp up sedatives to the point where they just die. And also the sequence, right? So they isolate patients, they starve them, they dehydrate them, they sedate them. I mean, the trajectory is horrifying, but then what we're trying to figure out is why at the very end did they just hit the kill switch?
I mean, that's a good question. I was going through chart notes, and I wasn't looking at the day, and I'm looking at this gentleman. His oxygen saturation was between 97 and 100%. I'm like, he was on the ventilator. I'm like, no, he's doing well. And I'll have to say something on it. And I'm watching. All of a sudden, it's like, God, vitals are done. It shocked me. I was like, holy shit, or sorry, holy crap, like, they killed him. And then somewhere in the 4,792 page record, there was one page that was a consult with his wife about terminating his life. And I'm like, what the heck? And so that's when, you know, they administered I don't remember what they gave him, but and in so many of these situations also, they'll finally administer antibiotics like the day before they end up dying. So they'll get so sick that they're in like they're septic, and they're like, we'll throw them on some Zosyn now. It's like, why didn't you do that 11 days ago? And I look through every page, and I look at their exam, and it's like, so bilateral crackles, et cetera, and it's like that's good enough to put them on an antibiotic when they're, you know, white blood cell count is elevated, they're febrile. Like, come on, that's not crazy to do. Like, anyway, so the money and even transferring out, like, holy cow, the hospital's trying to make it impossible to transfer out because you get, like, if they die in their hospital, that's an extra money.
So that's the question. Do we know if there is in fact a COVID death bonus if a patient dies in hospital?
I'm looking on my desktop at one that I got sent, where the bill was $1,192,000 for the hospital stay, and that's a good month's work.
Yeah, that's pretty expensive for a non-successful treatment protocol.
Yeah. So yeah, I can't. It's something that haunts me. I've advocated, you know, 17 states. I don't even know how many hospitals. The lack of humanity, lack of empathy, you know, where it's like, well, if you would have been vaccinated, you wouldn't be in this situation. I'm like, oh. Like the number of acutely ill vaccinated people I took care of was shocking, and their decline was quick, especially in Delta. And then, you know, and I'm all over the place. Something that was said earlier about the Omicron being, you know, obviously the symptomatology not being anywhere near Delta was. I made a statement about that where I said the one thing that scares me about that is people get complacent where it's just a 2 or 3 week cold, or I'll be talking to somebody and they said they had COVID, and anyway, and I'm like, well, why didn't you call me? And I'm like, oh, it wasn't that bad. I was only sick for like 2.5 weeks. I'm like, 2.5 weeks? I got COVID 4 times, and I've had symptoms for a total of 7 days, and they were mild. Anyways, the problem with that is you still have to spike protein to deal with, and you want to make it go away. You want to get it out. You want to stop it from replicating. But I have seen so many people. So I don't have my medical license. It's under permanent suspension right now. And so I did a bunch of integrative health practitioner certification. So I do consulting. And the amount of long COVID cases I've seen just over the last 6 months is pretty shocking. So I encourage people, like, don't be complacent. Like, just if you're, and that's one of the reasons that I recommend people test. I've got boxes of the rapid, and I understand that, you know, the accuracy, etc. But I over a time period, I swapped thousands of people, and for those that needed PCR to go back to work or school, the cycle count, like if there was a false, like say a false positive, there's almost always a cycle count over. If the rapid swab was negative, but their PCR test came back positive, that PCR test was always over 34 or 35. So the reason I recommend doing the home test, I swap out the I swap out the Q-tip. Because my regimen for treating COVID is pretty aggressive, and I'm not going to do that on a daily basis. I'm not going to triple, my vitamin D and C, and and just I think it's important to attack it early.
Right on. I think we can agree that was the key all along that had to be suppressed, right? So a real quick question, and then we want to kind of move to an open discussion if we can for a moment. Have you ever heard a hospitalist defend the COVID hospital protocols? Or is it just, they were just following orders?
Oh, Rim does, this is the best science that we have for, there's a phone call that got released to Alex Jones. I ended up getting caught up in that little turmoil there, where they were impassioned about how they're following the science, and they're using the best available science and medicine that they have at this time, and there aren't really any treatments, and mechanical ventilation is the best way we can go about protecting their lungs while their body tries. They're filled, literally these are words, they're filled with so much COVID. I don't know what that means, but that we're just keeping their lungs protected while they get fight through the COVID. I'm like, that I don't even my 11-year-old could defend that statement, or would be able to just tear that apart. So they're where we just can't do that, right? There are doctors where it's like, I've heard people using that, we just don't have it, and we don't have it on our formulary. We can't do that, or because they would get in trouble, obviously. But with the medical license, so it's something that this will be interesting. So on Thursday, I spoke with, so I applied for an Oklahoma license. One of the stipulations with Washington State is that I fly to Nebraska because they work with Acumen in Nebraska for an inpatient neuropsychiatric evaluation, which I'm not going to do because the way they had it, basically they had already diagnosed me with something, so I don't want to be on quetiapine or anything. So that was brought up by the secretary, the doctor, in the Oklahoma board, and I said, listen, I'm totally fine doing a psych eval. I understand when you look at the 42-page write-up of the Washington Medical Commission on me, it's a little daunting to go, let's let this character have a license. So I'm having a forensic psychiatric evaluation over Zoom on Thursday morning. It's like a 3.5-hour eval, and it's with a woman in Oklahoma, a doctor in Oklahoma. If I pass that, he called her the gatekeeper to getting a license, and that if I pass that, which he said I should based on talking to me, which is nice, it's likely that I could get a medical license in Oklahoma.
Good, man. Well, I really hope we pursue it.
So you brought this up. If it's $3,900 to do the eval, and we've spent 6 figures on all my other lawyers. So if you do know of any, I've been trying to get the hold of Children's Health Defense, and FLCCC had reached out, American Academy of Surgeons and Physicians, but and ICANN. The state is the state is difficult to take down. They're a much bigger force than me, obviously. So anything that you can direct me towards would be awesome. They suck you dry.
Yeah, man. Well, I think that we can launch a Get Sim Go campaign, and I think we can get that rolling. I'm confident. Like I said, I think that could be a precedent-setting case where some states stand up against the dictatorial insanity of other states. So thank you for sharing your story, man. It's awesome.
My pleasure.
You're a hero, my friend. You know, it's coming up all the time where vax injuries are being defined as long COVID, and there's a discussion about potentially being able to test people for spike presence and then being able to determine whether or not they've got the spike with the nucleocapsid, which would determine whether or not it was actually from the virus or just, I guess, the naked spike where it's obviously vax derived. Is there something could you all talk about that as far as how can we really start to differentiate between vax injuries and long COVID?
Well, I would say systematically there's an overlap. I've stopped calling it long COVID. I've been calling it long virus syndrome or long respiratory virus syndrome because all of the respiratory viruses produce this long, drawn-out pattern in some people. And many of them resolve on their own. It just takes a while, over a month to 2 months, but they resolve naturally anyway. And we don't know whether they needed to be treatment or not because we haven't done any randomized trials, so to speak. I'll get back to Fauci on that later. And so, you know, basically, this is medical Wild West. We're just learning about this. And there are some molecular assays for looking at the presence of spike in tissues. I don't know if they're commercial at this point, but they can be done sparingly. They've been done in some autopsy studies, I understand, but I don't know if they're generally clinically applicable. I think that the first line of duty is to get the people fixed. And that the wellness company's been doing this. Pierre Corey and FLCCC people are working on this, and I think others are doing this too. Things like nattokinase and other things. I'm a supplement skeptic. That means that I need to see both biological evidence and especially human evidence of benefit before I'll believe anything. And that means in a real, it doesn't have to be a randomized trial, but it has to be some kind of human trial evidence of some sort or other that's convincing enough to believe that there is efficacy for what's being claimed in humans. And I've seen very few of those kinds of studies. Vitamin D is one that's very clear. There's very clear benefit of vitamin D for keeping people out of the hospital from respiratory illnesses. But not to go overboard. A level of 50 to 75 is fine. You don't need to have 100 or more. That's counterproductive. People also say you should take vitamin K2 with D. All right, now we're into supplement land, and I'm not quite sure about that. There's biological levels, biological reasons to believe that, but I'm not sure there's human evidence of that yet. But it's sort of innocuous and inexpensive, and I think that's good enough to try it. And so I think basically doctors are in empiric land, basically trying these things that are safe on their patients and see how they work. And this is something that David Sackett, the nominal father of evidence-based medicine, said in 1996 when he was forced to defend the term evidence-based medicine. He said that it's a combination of using good doctors should use the best available outside evidence, meaning published evidence, but that was already wrong. They should use all available evidence. But anyway, and he said they should use clinical knowledge, their own clinical knowledge. And what he really meant was that doctors should pool their clinical knowledge across multiple different people, representative of all clinical work on the topic, on the question at hand, in order to figure out a range of clinical alternatives and their
And if you've
pluses
got to
and
leave,
minuses.
we're going to have this
Nevertheless,
recorded.
this still means
You can
using
check back
a
in and get it
clinical
later.
experience.
Thank you for being
And
patient.
Thank you.
I think almost everything that's new in medicine starts off with doctors using their own clinical experience to see, and they one guess is based on papers you read that come the closest to what you're interested in and the biological level understandings you have. and the safety that you know, and then you try these things and you see what they do. And I think that's how Zelenko started using hydroxychloroquine and azithromycin and zinc. And when things work, you see it pretty quickly. So I think that's kind of the way that one approaches this. That I don't know that you have to, I'm not really answering your question well, but I don't know that you have to separate the two. You have to treat them first, and then worry about, well, which was this, if it's decidable.
Okay, thank you. Appreciate that. Dr. Hoser, do you have any thoughts?
Yeah, I would just add that there are molecular biology techniques in sequencing the RNA where we could differentiate between the vaccine RNA, which contains 2 substitutions compared to the wild type virus. But those are not going to be able to be developed to employ to large populations. Those are not the kind of tests that we can readily do. And I think that screening for the spike protein itself would be the easiest. And theoretically, you could come up with an opposite version of the virus test where you're testing serum or some other sample for presence of spike, and on your strip you have the coded antibodies, so you're able to detect it. But again, the symptoms overlap and are ultimately caused by the same toxin, which is spike, so they would get the same treatment in the end. And then, so stop getting any more shots, don't get any more boosters and inject yourself with toxin. And then if you establish your health status, you should be able to contain infection where it's not viremic and going into the scenario of long COVID.
Well, yeah, thank you very much. So a couple of other questions have come in. Go ahead, Scott.
One thing that I've seen that's maybe a little more ubiquitous to the vaccine injury is the nerve type pain that you don't see in like with post-COVID, long COVID, the almost Epstein Barr, and that's from the very beginning. From the wild type, we've seen that almost Epstein Barr like fatigue, or with minimal, it's like I would tell people, don't be a hero, go mow your lawn on like day 5 or 6 because you think you're turning the corner, because it was almost inevitable that they would out a deep line the next day because they would overdo it. But then what we were seeing is like you're saying, like what's been discussed, the kind of post-viral syndrome that you see in a number of things, but the nerve damage, the tinnitus, the neuropathies that we're seeing in a lot of these post-jab patients or clients are just, it's unique to anything I've seen, and the how many people are suffering from it.
So a couple of questions. So the lipid nanoparticles, once they are all throughout your body, they're incorporated into your cells become slave spike protein generators. What are your thoughts about how long that process stays on? We know there's no off switch until cell death, basically. And then what's the future like for the folks who have had the shots as far as long term, and then could this even transfer to subsequent generations? Any thoughts? Or is this the big mystery that it's the Wild West, right?
Yeah, I have a couple thoughts on that. For one thing, I think, everybody is wanting to come up with the phase 2 magic pill to get rid of spike protein. But I think that we have to acknowledge one thing, is that the intent of early treatment is critically important. If you have a patient that is, manifesting with a full viral syndrome on day 2 or 3 of the illness, they're likely going to be pretty ill, and they will be subject to secondary bacterial infections and all the other comorbidities associated with a severe viral illness. And if we don't treat that, and particularly with this bioweapon, with the production of the spike protein, then what that spike protein is doing is causing multi-organ inflammation and fibrosis. And once that scarring in these tissues take place, thanks to the lipid nanoparticle technology that allows it to even cross the blood-brain barrier, you've got this spike everywhere throughout the body, doing its harm, injuring organs. I don't see how that can be reversed. At least I can envision possibly clearing the spike protein, even if it's being generated. I think there may be a mechanism for that, but I think what we have to actually honestly face is that when the damage of the scarring is done in these tissues, then the damage is done. And so we're going to see, for example, a decrease in the fertility rate, fecundity, because when the spike accumulates in the gonads, the ovaries and the testes, and there is scarring of that tissue, that is going to decrease function. And I don't see how that would not be a permanent hit to the body. Any other thoughts on that?
Well, Abraxas, you had posted that, I don't remember when, it was a few days ago, and I've been looking into that, and I just have to preface that I'm not an expert in anything. I just like to read. So and I don't have any studies on this, but I've been doing moderate, or I would say fairly aggressive use of 20% acetylcysteine, and it's not by itself, because I was looking into GHK, which is glycyl L-histidyl L-lysine, because there's a lot of PubMed on it. The NIH has studied that peptide because of its binding to copper, and I just pulled one up where it's GHK attenuates cigarette smoke-induced pulmonary emphysema and inflammation by reducing oxidative stress pathways. But I mean, there's the mechanisms with which it does it. We're told that we can't, but I'm hopeful that there are, we have to, with that, and red light, sauna, ozonation, just ways to just just getting that new fibroblast activity and healing the cells. I think it's there. It's just not something where there's a ton of data on it. I'm hopeful.
Yeah, it's important to be hopeful, right? But I think we also need to realize that when there's an absolute eugenicist behind this operation who's all in for injecting the entire planet with poison, Bill Gates specifically, if you're injecting the entire planet with poison, knowing that poison sequesters in the ovaries and the gonads, as you said, clearly the goal is depopulation. We don't know for sure. We know there have been some effects, but it's pretty obvious what the plan is, and it's just a very sad reality we're in. So I appreciate you all being all in, trying to help these folks who have been injected with this stuff. It's terrible.
I would just like to add that it depends on the individual. So every individual has a unique physiological state within their own body. We're a very heterogeneous population, so the biodistribution would probably differ on an individual basis, and then how long the spike protein sticks around would also vary. And then we also have to remember that some sites in the body are immunoprivileged and may sequester antigen for a longer period of time than other organs.
And the other thing I found is methylation, right? So people that are, it's another area where it can be debated, but that are more significant undermethylators and their detox pathways. I've done tons of labs and looking at their level of glutathione, low levels of glutathione, their ability to process and convert their B vitamins into active form. Just those little things, or the ability to convert nitric oxide. Anybody that's a mouth breather, is going to have a much harder time because breathing through your nose is how you humidify and oxygenate the air, and it's converted to nitric oxide. That's not going to happen if you're sleeping in a mouth breather, and your sleep's going to suck. So, there's so many other things also that are going to have impact.
And how about shedding? That's been a big concern, whether it's through breathing, kissing, intercourse. How do we ever find the answer to whether or not that's a thing?
Pfizer said it was a thing. It's in their doctor brochure. It says that a woman of reproductive age has intimate contact with a recently vaccinated partner, that she should report herself to Pfizer. It doesn't say anything about what that means. I suspect that it's not the vaccine that's being shed, it's spike protein that's being shed. And I don't recall does anybody know if you've heard of any such women who report menstrual irregularities from things like that? I don't think there's been very much. It doesn't seem to have accounted for much. It's more of a theoretical possibility from what I know so far.
So actually, I have a story for you. When we began our town halls, I had 3 friends who were unvaxxed, but they were absolutely bleeding to the point where 2 had to be hospitalized, and 1 actually needed a blood transfusion, and they all attributed it to shedding. And then the question I always had was, is it actually shedding, or is it the pheromones where the vaxxed woman is putting off some kind of signal like all hell is breaking loose, sending out some kind of danger warning? Who knows, right? How do we find the answer to that question?
I think there's empirical evidence that I've seen today, even with my own family. I've got a daughter who's an RN who works at the Mayo Clinic here in Phoenix. And when all of the nurses who took the shots got the boosters, those who didn't actually tended to get sick. Quite a significant number of them, including my daughter, within a day or 2 after they got the shots. And this illness, if you want to call it that, lingered for perhaps 2 to 3 weeks before she fully recovered from that. And she experienced 2 episodes of that. So I think that's the best evidence we have. It's something that's very hard to study, but when we observe what actually happens, I think we've all heard some reports of that. And as I said, I got to actually experience it with my daughter and talk to her about that. So it seems to be a real thing based on just our clinical observation.
Guys, I've been here. I'm Christine Dolan. I'm an investigative journalist and senior editor at CD Media. I had interviewed vaccine-injured off camera since January of 2021. Many of those either participated in so-called clinical trials in 2020, or they signed up to receive their shots in the early rollout in 2021. So for 6 months off camera, many of them were healthcare workers. They were doing scientific research in the hospitals. They were nurses, dental hygienists, surgeons, specialties in their own field, but in the health industry. Many of them were women. And most women don't want to talk about their periods on camera. But I can tell you that there is not a woman that I interviewed that I didn't ask that question. And the most startling thing for me is the fact that, yes, they had issues. I received phone calls from friends of mine who had 15-year-old daughters on volleyball teams who were not vaccinated, but the rest of their teams were, and then all of a sudden they had issues. I interviewed a woman who in fact was 10 years postmenopausal, and she started to bleed after she received her shots. So the anecdotal evidence is there. The doctors are not asking the questions because the FDA has not, and I say this and it makes me angry as a human being, as an American, and as a journalist. It is fact, not fiction, that the FDA has known about these complications from vascular and neurological since January with my documentation and research of 2021. And to date, Dr. Peter Marks at the FDA has not officially acknowledged the neurological and the vascular injuries, and he has even been on Zoom calls. His staff has been with many of the vaccine injured, and Dr. Peter Marks actually had a conversation with a surgeon who was injured, and Dr. Peter Marks said he would like to officially acknowledge them, but he can't. So this is willfully done. These people are doing this consciously and without a conscience.
Why can't he?
People need to remember.
Why can't he?
Because somebody up above him is telling him he can't. He didn't give the answer to that question, Harper.
Well, so this was a question that I was asking, is it's not like the head of the FDA or CDC or whatever is telling him, because they don't have that much sway over it. There is something above those agencies that is controlling this narrative, which I've asserted is the military establishment, the Pentagon, the DoD.
Well, but there's also the whole notion of vax hesitancy. The same way that they didn't want to create any vax hesitancy. So if you acknowledge the vax injuries, you're going to create the vax hesitancy. I look at this through the eyes of somebody who was trained as a criminal investigator when I was in law school, and also have been doing this for 40 years as an investigative television producer and reporter. There's two things in terms of the big picture. One is that they didn't want to create the vax hesitancy, and then also why did they put so much effort into shutting down the lab leak in February of 2020? They had to shut that down because if they had opened that up as a possibility, world leaders may have been pushed to say then you need to shut down the research and the funding for all of this Frankenstein science. But keep this in mind, at the very beginning when they said it was the wet markets, the world leaders never said anything about, well then let's just shut down all the wet markets until we can clarify the origin of this. They never did that. So when you're looking to the prism to get the answers, keep this in mind. You have to find out not just what they did do, but what they didn't do under normal circumstances. And
China's claimed to look through all of the animal types in the wet market in Wuhan and not find a proximate source for what that's worth.
And France and Dr. Fauci said that there weren't Americans inside China, and I have a picture of Cliff Lane, who works for Fauci, inside China, early 2020.
Oh, that's silly. Stefan Bancel, when he worked for Biomaria, Biomaria built the BSL-4 lab up to WIV. So Bancel knows everybody in that place backwards and forwards.
Right. That's right. So, I mean, it's intentional lying all the way down from the very, very beginning.
I'll just have to say one thing, that the EMA, the European Medicine Agency, was calling out adverse events fairly early on, specifically with menstrual cycles as a vaccine injury. And I am aware, not that this is any sort of accountability, but the FDA is requiring follow-on myocarditis trials for any vaccine containing spike. So they're aware to some level, but I agree 100%, Christine, that it would promote hesitancy, and part of this whole effort was to achieve compliance across the population and compliance with the lockdown and the passport system overall. Are any of you aware, was the Wuhan Institute operating under a biosafety level 2? I recently heard this, and that would make it very easy to have a lab sick.
That was my understanding, that at least
Yes.
the intake and initial processing of the bat sampling from, was it Mochang in China, the caves there, were in BSL-2. And it's hard to know exactly which functions went in BSL-2 and which in their BSL-3 or 4.
And there's also communications that I think this was in spring of 2019, concerns about all of these Frankenstein labs not having the safety protocols. But the truth of the matter is, I did an interview with Dennis Carroll, who was one of the co-authors of the February 2020 Lancet article when they said this did not come from a lab leak. And he also has acknowledged how dangerous this Frankenstein science is. But at the same time, they still get the funding. And it's not just from DoD, Harvey, it also comes from the State Department. The PREDICT project that began in 2009 came under the State Department with USAID, and a lot of the people that are connected to that Lancet article, like Johanna Mossett from University of California at Davis, Dennis Carroll, Peter Daszak, the rest of these people, they have set up at USAID, even though the PREDICT project was shut down in September, the last September of Trump's administration, they actually have a PREDICT project too, and it's just friends of friends. And it's connected to the same people like Nathan Wolf, who owns the Metabia labs that are in the Ukraine. There's over 30, I think it's 32, 33 countries, something like that, but it's over 30 countries where they have these labs. And there's a consortium, and it's not just China and the US government that puts money into this. It's countries like Norway and USAID and the World Bank and IMF. And I mean, this is a model to create an economic market for a concerted effort to have a mandated seasonal COVID vaccination, and it's coming out of the White House. I've got the documents from September 2021 of the Biden administration, and that's connected to all of the amendments that are being pushed at the WHO in May. That's why it's important for people to wake up. This is not done in a vacuum. This is not like Peter Malone or Dr. Malone says, we don't know who's behind door number one. No, we know who's behind door number 1, 2, 3, 4, 5. This is a concerted international effort to basically give up people's sovereignty underneath the WHO so they can proceed and create this, so they can have a marketed, mandated, seasonal COVID vaccination through the Frankenstein study that the government's paid for, and the people who benefit from the data that is of the coronavirus to create these vaccinations is the pharmaceutical industry.
Yeah, but the
Very
pharmaceutical
quickly,
industry is just not big enough player in this compared to the military, segment as a whole. And don't forget Peter Hotez, who's also been doing this gain of function research while he's telling that unvaccinated people should be locked up or killed. He's a prime culprit in this who just doesn't get enough attention to his nefarious activities.
I don't like to race him too much though, Harvey, because I don't want to elevate this fool.
I understand.
Yeah.
Although the diffuse document was not funded by DARPA, a very similar strategy was funded by the NIH under an R01 that was led by EcoHealth Alliance and Peter Daszak, and we're not talking about that, and I have a link to the grant itself that began funding in 2014 for that work.
In the NIH report, anybody can find out all of the Daszak's grants, NIH grants from the NIH reporter, and same for Hotez.
Right, and also Callahan. Callahan actually has had something called the Prophecy Project.
Yeah, right, and you can also, the NIH reporter, until somebody takes it down after my saying this, also lists the program project officials who are the people who are monitoring these studies and who are primarily responsible in the regulatory aspect of running these studies for NIH, and who are the first line, should be the first line of information as to who signed off on these grants, for their appropriateness.
I actually did an interview with Dennis Carroll, who's one of the co-authors of that Lancet February 2020 report. I started talking to him in 2020, and I got him on camera in July of 2022. It's about a 90-minute, and it's posted on our site at cdm.press. And if you just search for Dennis Carroll's my interview, it's extraordinary because he consciously, without a conscience, tries to defend this and the lab leak. I made him uncomfortable at the end of the interview because I told him that both he and I knew that there were going to be people probably getting in trouble because of the lab leak, and he had to end that conversation.
Well, so the other thing is there's leaks of viruses from labs every year all the time. The labs are Swiss cheese, and so why aren't we doing anything? The BSL-4 labs are supposed to prevent that. Why aren't they being used? Why are there continuing to be leaks of all sorts of different organisms from these labs so that this one isn't anything novel because it's happening all the time?
Do you
That's a question for...
think that it was accidental? Everything seems so purposeful about every single, like the playbook. So, do you think it was an accidental? Like the nefariousness and the I call it just the brutality with which people's lives were shut down, destroyed, et cetera, and then people just like like killed in hospitals, like that seems like they would
Callous indifference to human life. That's right. The whole thing has been, it's not murder, but it's callous indifference to human life, which is a legal term, and you know, has consequences.
Not only that, but in some cases, you know, if you can't get your health advocate into the hospital, sometimes they're not even listening to you, because I've interviewed people whose family members did not agree with, nor did the patient agree with, do not resuscitate orders. And they later found that, in fact, in some cases while it was happening, they had put down on the chart, do not resuscitate. So, you know, there's a lot more for people to get aware of. It is unhealthy and it's dangerous for somebody to go into a hospital these days without having a health advocate that's a pit bull.
I agree with that completely, and there's plenty of evidence for it. I would say this is not just rampant callousness or carelessness. I think this is intentional harm, and it goes against everything we are taught in medicine. But I contend that we always have to remember that medicine has merely been the vehicle to carry out a higher, more sinister plan than we ever imagined.
It's against the 10 Commandments.
That too, absolutely.
I'm going to turn it back over to Brax.
And this is a little off topic. Talking about the shedding, I've had situations where, you know, a mom would bring her 8-year-old in, new onset nosebleeds, never had a history of it, and you know, everything looks otherwise fine. He doesn't have allergies. The turbinates, you know, the mucosa looks fine, and you know, there's a few other things that were going on. And then I asked anybody else having just random bleeding, and it was like postmenopausal mom and a teenage daughter. And they're like, did anybody get the shots? And I'm like, well, my husband did, so he could travel for work. I heard a version of that so many times over the course of, well, like from February of 2021, and my license was lost in October. But from that time frame, I heard that so frequently that it was just, I was stunned that became part of my routine.
It's a sad statement on humanity, but here's Brax.
So why wasn't the husband bleeding? If everybody else was bleeding, why wasn't the husband bleeding?
Don't know.
Bleeding isn't that common
No.
of a reaction to the vaccine itself.
Well, and usually it wasn't, I didn't see nosebleeds that frequently. It was usually menstrual bleed, like abnormal menstrual bleeding. That was the one I just remembered it specifically because the son was having a nosebleed, you know. And I haven't heard that. Usually it was the irregular menstrual bleeds.
Right, and I heard this also from a hospital who I know a particular nurse who was involved in the hospital, who told me that there was a large number of nurses and staff reporting for abnormal menstrual bleeding in the hospital. So, but that was from active vaccination, not just passive exposure.
Then one more point on the gain of function. I just want to remind the audience that the moratorium on gain of function was lifted in 2017 specifically for coronaviruses.
That put into place the P3CO regulation for reviewing gain of function experiments that had to be signed off by Fauci and Collins. However, the Dash Act EcoHealth work was going on through 2014 to 17, nominally before the P3CO framework. But
Good point.
they have claimed, however, that it was signed off through the P3CO framework, even though it didn't exist until 2017. So I'm not exactly sure what the origin of the P3CO framework is, that it might have existed informally before 2017 anyway.
Sounds like it was backdated to me. I'm going to have to jump off here. I just want to thank you again, Brax, and Delaware Medical Freedom Alliance for hosting this, and all of our physicians here today. Thank you.
Yeah, you're welcome, Mary. Hey, Mary, there's something you may have I don't know if you can see this or not.
Whoa, the war. What's it say?
So we made a cake to celebrate.
War on us, 3 years.
I'd like to make a wish that enough people wake up that this never happens again. So as the WHO tries to take over the sovereignty of the world, we all need to individually stand up and just say no way.
Yeah. Here, here.
Comes to me.
Absolutely.
It sure does. You know, and that's really one of the reasons a lot of us got engaged. You know, it's like you gotta stand up, you gotta do something. What do you do? Who knows? Just do something, and eventually you'll develop a tribe and you'll create momentum. So I hope people really realize how important it is to take responsibility for their families and for our future together. So thank you all for what you do and for contributing to this evening's discussion.
And then allow the live audience to ask some questions of some of the people in here in a few minutes. Although Braxis is
Just being real quiet.
so just give him a few
He only
minutes.
paid for an hour.
Because I think Braxis and Christine will join us. Yeah, I think they're coming over here.
Easy to say this.
Have any questions?
I think they're afraid.
If you guys have questions now, we could probably get started.
Go ahead. No, you go ahead. My name's Sean Erickson. Glad to be here. Dr. Mavropatis, I know you. It's good to see you. I just wondered what we can do about Big Pharma. They seem impenetrable and invincible. How do we, I mean, you know, every 5 minutes you're on the TV, watching TV, you get one of these ads. You had mentioned that in your talk, Doctor. They seem like they run the show.
Yes. So I think there's many things that we can do. Some of the things that I mentioned was to get rid of direct-to-consumer advertising. I think a broader picture that we need to look at is our political situation. So the overwhelming majority of the politicians in what I call the duopoly, the Republicans and the Democrats, you know, a lot of money coming to them from pharmaceutical companies. So we need to look at that and the revolving door leadership roles of the pharmaceutical industry and the public health sector. And some projects that are being worked on now is alliance between lefties and liberties, I would call it. It started with something called Rage Against the War Machine, and they had a rally that was united across the political spectrum a few weeks ago. And we had 22 sponsors, including people from the right, the left, the middle. Tulsi Gabbard came, Dennis Kucinich came, Ron Paul came, and so this coalition, for which I'm a part of, is working on a grassroots effort to really have coalition voting and a political movement that breaks us free of the duopoly control, which is infiltrated by the pharmaceutical industry. So what I would say to you is whatever political affiliation you are, is find people who are like-minded, which this COVID mania has led us to understand. And if you have any questions, just message me. I can get you involved in the coalition. But we're literally forming state-by-state coalition groups where we unite lefties and liberties to change the political atmosphere. And it really is possible. We united against the war machine, but we're all talking about all the other things that we agree upon. And so what you should do, in my opinion, irrespective of your political affiliation, is to talk to your neighbors and talk about the things that you agree on. And we need to get the legislators out of our state and federal, right? And we need to not allow the Republicans to split us over these 5 divisive issues that we're never going to agree on, and really talk about what we do agree on. which is our constitutional rights, our civil liberties, the right for life, liberty, and the pursuit of happiness. So what I'm saying to everybody everywhere, not just in Delaware, is to become politically active and either run for office or help someone run for office. And don't act like a Republican or a Democrat, even if you are. Just be a human being and don't take money from the pharmaceutical industry, and be better. Because we the people could really take back the state and federal legislature. That's what I think we should do, and we're doing it. So if you have any questions about the coalition, you know, find me, email me. I'm myself on Twitter, so
Great, thank you.
thank you. I hope I answered the question.
With regards to the political aspect, where you put your money, put your efforts toward, I really would want to see all corporations, any corporate entity, any organization, any PAC, or not be allowed to vote in any of our elections, and that goes from the county, the local, the county, the state, the federal, all of it.
Yes, I agree.
Because they are not we the people.
That's
They
right.
are not we the people. To me, that is just a political bribe, and it should be illegal. Period, bar none. So I know that the cost of advertising is outrageously high. Good, it'll bring down the cost, because we the people are going to vote with our conscience, our hearts, and back it by the Constitution. So if I'm only going to donate $10,000 to somebody's campaign, if I'm allowed to donate that much money, then that's fine. If somebody else can only donate $5 to a campaign, that's fine. Those are we as people. It is not billion-dollar corporations who are now woke. This is not woke, so to speak. It has nothing to do with anybody's, being persuaded one way or another, or, prejudice. It has nothing to do with it. If you're against China for releasing this horrible plague, that doesn't make you against Chinese people. It's the government. And then thank you for bringing up about the World Health. That's what we have to fight. I'll tell you this one guy that is, I've got my eye on him, Klaus Schwab. Yuval Noah Harari, they're with the World Economic Forum. And he said, mRNA changing the DNA under the skin. Countries will begin negotiations on a zero draft of a new, I've got to read my writing, pandemic accord. And it's talking about.
They're doing it right now.
Yeah, so it says, and then Harari, Yuval Harari said, they call him the prophet. He's a false prophet. I'm a Christian, I will call him out as a false prophet. And he says, COVID makes surveillance under the skin. So they want to decrease the population, kill you any way you can. Now they want to give innocent babies, put them on the vaccine schedules, for no good reason other than why? Look at the elephant in the room. Everywhere we go, right back from the GMO foods.
Well, it's worse than you think, because this is Delaware, this is Biden's home state, all right? And I'm not blaming the blame on the people who were in Delaware that voted this guy in, but the truth of the matter is that but the truth of the matter is that this is, in my estimation, probably the third Obama administration, because there were some heavy hitters and a lot of the same players: Susan Rice, Samantha Powers, Jake Sullivan. They're all part of the same game. The social media attack, the marriage of big tech and pharma and government is not new. It was big tech and U.S. government for Verizon. I covered that, and what they did. And it's in plain sight if you read. Even Hillary mentioned it in one of her books. She was so proud of what they did. What they called soft power is they use your money, taxpayers' money, through the USAID State Department. And they actually brought people from different foreign countries to spots like Latvia and Lithuania and train them how to use social media through what she would call the civil societies to hold their governments accountable. She always met with civil societies on all the million-mile trips that she took as Secretary of State. But the truth of the matter was that we were training. Eric Schmidt, Google, Alphabet, Twitter, Facebook, everybody was involved. And we were training civil dissidents to overthrow foreign despots that our U.S. government wanted to overthrow. The only spontaneous thing that came out of the Arab Rising was the fruit cart guy in Tunisia who put gasoline on it and fired him up. But this was all in place, and then all of a sudden there was a ripple effect across all of MENA, North Africa into Egypt, all right? So that was a good trial run, but this is the tech and government, tech and politics. 2008 is when they really picked it up with the Obama campaign, and they hired people from social media that worked in his campaign, in his office in Chicago. You could pretty much predict that this guy was going to win because they were targeting people, whether you owned a Ford or whether you owned a Plymouth. In 2008, they knew how to target it at the time. So what you're feeling is something that's bending. What you're feeling is something that's been used overseas. What we're doing is we're actually using it here in the United States. But it's not blinded. We know who's doing it, all right? But it's a matter of waking people up and letting them know. And it's not going to be easy. I totally disagree with you. It's not going to be easy for coalitions coming together. No Labels, which is based out of D.C., which is run by Nancy Jacobson, which is run by Mark Penn is her husband. They're old friends of mine. He was the pollster for the Clinton White House. They had a falling out with the Clintons. No Labels is going to go out there. They're going to run a candidate that's going to bring people together. There's other people talking about running for president. You know, some as a Democrat to challenge Biden. This is not going to be easy. So don't think 2024 is going to be easy at all. It's not. It's going to be a bloodbath.
Yeah,
And people need to wake up and get educated, and there are things you can do. You can wake up people this year, in the next coming months, about what's happening at the WHO in May of 2023. They are going to vote on the international health regulations, the health regulations of 2005. And in those amendments that were put forth by the HHS, Biden's HHS, are amendments that basically will usurp anything that happens in Nebraska, because the Biden administration agrees that the health policy is a global security policy, and if these amendments go through, it changes how this country is governed. There's 47 countries who agree with the Biden administration, so just half of them are the EU. And if they happen, if something happens in Nebraska, if something happens in Delaware, it is a fact. It's not fiction, it's not speculation, it's not conspiracy. These are their documents. The Biden administration is saying that Tedros, or whoever is the Director General of the WHO, and his 6 regional directors, can decide what the policy is in Nebraska or Delaware, and it can usurp the head of state of the countries.
Will that get past the Senate?
It doesn't have to go past the Senate.
I mean, they can
Because it's
bypass
not
it.
a treaty. This is something that was passed in 2005, so these are amendments to that. But the treaty that you're talking about, and sometimes people use the word treaty, some people say accord, they want to bypass it for the Pandemic Preparedness Treaty. They're supposed to be voting on that in May of 2024. But here's the kicker, and this is what you need to pay attention to. Prior to May of 2022, when the General Assembly of the WHO was held, the WHO came out and they said their intention is to vaccinate 100% of all healthcare workers worldwide. Secondly, their intention is to vaccinate everybody worldwide who is 60 years of age and older. Number 3, they want to vaccinate, regardless of age, everybody worldwide who has an underlying condition. So anybody that's doing business with WHO needs to understand that's their end goal. So when Fauci was being interviewed and challenged by people like Jim Jordan and Rand Paul, and he couldn't answer the question. So herd immunity is what, 60%, 50%, 30%, 80% of Americans vaccinated? He didn't tell the truth because he didn't say 7 billion people. But that's what you're dealing with, okay? So the WHO is 2023. People need to get educated about this. I can send some links to Braxton. He can forward it to you so you can get up on this. But it's really, really serious, okay? We have a guy who's a contributor with us, David Bell, who worked for Gates, worked for the WHO. He's big in the world. He's a doctor, he's originally from Australia. Sasha Lapopova is a specialist on manufacturing. There were no standards of practice for manufacturing for any of the COVID shots. There were no clinical trial standards of practicing. They blew them out. Brooke Jackson, who's the Pfizer whistleblower, is a friend. Sasha is a friend. Brooke is an expert on clinical trials. She's been doing it for 20 years. So it's serious, but people need to not just take in everything and show the rage. When you're talking to people, you have to be informed, it has to be logical, and give them something, not from somebody who doesn't know anything about the WHO, but from somebody like Bell who's worked there, who's negotiated, who's been in contract, who's been a consultant, who's actually out there and is speaking out against them. Not somebody who's sitting in Iowa, who has never knows the culture. All right? There are people that have written about the WHO and the World Economic Forum that have no idea what they're talking about. None whatsoever. And so when you're looking at people, understand that the people that you need to be listening to are Peter McCullough, people like Harvey Risch, you guys, but don't go out there that somebody says, I'm the leader of the pack. Because there's been a movement going on about this, all right? And I've read a lot of books, I've interviewed a lot of people out there. But there are some people that are part of this movement that have no business being in the movement because it's about them. Okay, but Pierre Corey, Dr. Merritt, Harvey Risch, these guys are good. And Peter McCullough, they're good, they're the real deal.
But I think it's important to make people realize that we still have to be hopeful about a couple of things. And, you know, I can get really pessimistic about things like the next Moderna vaccine is for heart failure that you get from the coronavirus vaccine from the myocarditis.
Pfizer just bought a cancer company today. So they're all moving into the mRNA.
Right, so the idea with the mRNA technology is to be plug and play, where, you know, you have the next thing. And, you know, 2019 of September, the NIH gave Graphex, a vaccine company, $19 million to work on an mRNA adenovirus coronavirus vaccine. That's September of 2009, before we even had coronavirus per se. But I just really want to, again, talk about the fact that you have to talk to your friends and neighbors. If everybody here tells 10 other people the truth, what they understand, who they follow, and take real human action and get involved in local politics and things like that, and really change the collective narrative, we can make a difference. Now, that may seem incredibly optimistic, but we really don't have a choice. So please just don't tweet about it and talk about it and all this other stuff. Come to conferences, but actually get involved in your state and federal legislature and talk to people across all sides of the political aisle and get we the people elected.
Because they have a plan. It's our job to push back against it.
Right, I mean, the World Health Organization is just like the CDC, they're partially funded by the pharmaceutical industry arms of their foundations. I mean, it's all ridiculous, everybody knows this.
It's an octopus, and don't forget, Pfizer said they only provided the fraud that Pentagon asked them to create, right?
Right, I mean, they disclosed that this was, right.
Question in the back.
Yeah, I have a couple questions, if that's all right. Thank you all for coming tonight, first of all. I appreciate your time, sincerely.
Yeah,
I have a couple questions just about like more local state issues. Obviously, as we know, they have these conversations, what I call quack-scenes, to the CDC children's vaccine schedule. So I'm concerned with what Delaware is going to do with our schools and how can we effectively fight back and work around that. And then part two of that question, I have an older child that's going to go to college next year, and for instance, I know the colleges in Delaware, specifically University of Delaware, is still requiring it. I don't know if you guys know ways around that. That's kind of, go ahead, sorry.
Yeah, so UD was greenlighting all religious exemptions because they didn't want to violate individual rights, which is insane, because they were denying medical exemptions that were actually clear, obvious, and real. So religious exemption with UD is important for sure.
Right, so locally, it is on the child vaccination schedule. In Delaware, you can get a religious exemption, for your children.
They won't
and-
honor them even with the.
Well, so,
You don't need it for K through 12.
for COVID right now, but it was just put on the childhood vaccination schedule by the CDC. So his concern is subsequent to, are we gonna have this problem where the Delaware Public Health is gonna subsequently recommend it for K through 12 in the future, right? That's your question.
So when will
They
it
won't.
be on the actual requirement?
They won't.
No.
You don't think so?
Well, let me give you some history on this.
Why?
Yeah, why not?
No, 2015, you cannot have a medical exemption for a child. A religious exemption, I'm sorry, for a child in California.
Yeah.
Followed by New York, followed by Maine. There was a pushback in New Jersey when Governor Murphy was, right before he was up for re-election, and he won. They kind of backed off, but they're moving on that. And then Connecticut passed it in 2021. So when you think about how Biden is ruling by executive order, and he's using the administrative, what I call the administrative state, it's not Congress, it's not judicial, it's not the executive branch. He's using what they call the administrative. And one thing you have to take a look at is how your state governs. In New York, for instance, Kathy Hochul has a regulation for health quarantines. It went to court. The judge said that it's unconstitutional, overreach, no due process, deemed it horrible in July of 2022. She was up for re-election. Attorney General Tisha James was up for re-election. They noticed to the court, okay, fine, we're going to appeal this. They had until January. They actually went in January, and they put the court on notice that they're going to appeal it. So you have to not just take a look at where it stands. You have to take a look at the people in your state and understand that there are people that are part of the local cabal, part of the state cabal. They're all getting money. Biden is using your money, everybody's money, to harm. Now, that sounds crazy, but I remember one of the first times we met, we were laughing about how insane this is, because how do you convince the public? You're paying for the harm that you're receiving, because you're allowing somebody to use your tax money as a wild ATM machine. So in terms of your children, depending upon where they go to school, take a look at what state they're in.
No, it's Delaware. That's what
Delaware, okay, and then you have to take a look at who's on the board, and take a look at who's part of the Biden cabal in Delaware, and take a look at who's being bought off. I just finished about 18 interviews of 30 plaintiffs who were suing United Airlines because the CEO, Scott Kirby, bought into everything. And I can tell you that I used to work at CNN a zillion years ago, one of the 4 networks I worked at. There's a guy sitting on his board who's a past president of CNN. Now, I just broke a story in the last 24 hours about a pilot on United going from Guatemala to Chicago. It got grounded in Houston because the guy collapsed. We were able to pull the internal documents. What the airport spokesman said to the Houston television station was, in fact, that it was technical problems. When we got the records, he was the guy in the left seat. He's a captain. He had chest pains. He ended up in the hospital. Now, for anybody who knows how to fly, and I'm not a pilot by any stretch of imagination, but I talk to a lot of them worldwide. If you're sitting in the right seat, they couldn't get the guy out of the seat. So the guy on the right side, that could have been a newbie that wasn't, had to land the plane. They couldn't remove the guy out of the seat. All right? But the spokesman for the airport said to the local TV station in Houston, it was technical. Yeah, it was technical because the tiller on this side can't be controlled from the guy on the right side. But the reason why it happened is because he had chest pains. And they mandated vaccinations for employees in August of 2021. Some people applied for religious exemptions, and then they were put on unpaid leave, and they didn't have any access to any of their benefits. So you have to understand how the game is played in the arena that you want to attack. It's not all about advocacy. It's about playing hardball. And if you think about this, there's no greater hardball worth playing than the sanctity and the life of your family and friends. That's it. This is a war. And this is a mission, and everybody has to get rid of the politeness about this and get into sort of a mission mode that this is evil. And keep this in mind. Evil spelled backwards is live. And that's what people need to hear. They need to hear that because it's simple. If you want to live, then you got to get evil out of your life.
When the government's trying to kill you, survival is resistance.
Mm-hmm.
So
Yep.
you all don't know this, or you may know this. Some of you may, some of you may not. Christine has been a global powerhouse, fierce warrior for decades. I mean decades. It's such an honor to have her on our team, on our panel, involved. Thank you for all you do.
Thank you.
So I was shopping the other day and I saw this sign and I thought, oh my goodness, someone needs to have that. So there's a woman. It says, they whispered to her, "You cannot withstand the storm." "I am the storm," she whispered back.
And everybody else should be their own storm. Seriously, don't take no for an answer. Just don't take no for an answer. And there is progress when you talk about, I've seen it now because I've been covering COVID, worldwide for the last 3 years. There is progress on this because once you convince somebody to get educated about this, very few people go back to the other side of the table because once you see it, you can't shut it off.
Can't unsee it.
So just and pray for them, okay? And everybody has their different epiphany moments. Everybody has it. But just pray for them because once you see it, it's really tough to go back. And if you're a believer, read Ephesians 6 and just buckle up with the armor and embrace it.
Yeah.
Do you know why I'm speaking today? Because a year and a half ago at a town hall, we had dinner with a whole bunch of people, and I told you that I was afraid to speak out, and you told me to read Ephesians 6, and that I shouldn't be afraid, and that I was obligated as a physician to start speaking out. That's why I'm speaking
I did. Yeah.
Because I wasn't speaking out as a physician until recently. Because of that woman.
I have a question. I really, make sure. CMS, when are they going to go down? And here's what I see. David had one stone and he took the giant down. What's our stone? The Lord, but what's our stone? To slay that CMS giant because I want to say, I work for BB, but I work for Bay Health. Just shy of being 65 or 64. Lost my job because of the CMS mandate. Now I was work from home, went every week. I did medical billing at that point. I managed BB before, but worked from home for 2.5 years. But I had to go in once a week, every week, subject myself to go into the hospital to get the swab. Had all negative results. I had COVID, but that was before they started, making this weekly testing. So I had written religious exemption requests. Everybody got them. So certain other religions.
Except for 3, and we got attorneys to represent people who got denied on a contingency basis. I'm not sure you got that contact.
No, but I wrote like a 3.5 page, and I cited certain things that I had found out were in the vaccine and so on and so forth. But,
Yeah, we found some attorneys that are representing a large proportion of the Bay Health people whose exemptions were denied. Bay Health denied the religious exemption of the chaplain that works
Yes.
in Maine,
Yes.
who's a friend of ours.
Yeah.
And he had to resign.
You can't believe what's going on in
yeah.
this country.
Yeah.
I mean,
So-
and I've heard a lot of it, but that's the most ridiculous.
Oh yeah, I mean, he's great. He's spoken out. He's been on Alex Jones, and you know, he's been someone that's been really eye-opening, and he spoke at some events. But there isn't a local attorney. Jay?
This is his statement here, back on the literature page. He has a 2-page statement. You're welcome to help yourself to anything on this page.
Okay.
Or on
Yeah.
this page.
Chaplain Isaacs, and he wrote that was his testimony. But just find one of us. There is a local attorney that's taking the cases against Bay Health on a contingency basis. He's not taking all the cases, but he definitely was very cooperative. Me personally, I've had my, I've been COVID testing every week since 2 or 3 years now, because I'm medically exempt, because I'm vaccine injured from the flu vaccine. And because I'm a physician, I've been COVID testing every week since then. So,
So
yes.
what type of board do they expertise, I'm talking about, to decide who actually qualifies for a religious exemption? Are they doctors? Or is it just HR? Or is it the board of directors? Or is it actually bona fide religious people
yeah.
who are qualified to make that decision?
They make it up as they go along, depending upon the organization, the group, and the school, and everything else. I mean, don't expect these people.
No,
Look,
we don't know.
you have to. Let me ask you something. Let me ask you something, and let this land with you. Do you people know what evil looks like? Seriously, do you really know what evil looks like? Do you really get it that it's among us? When you see the chaos, when you see the dysfunction, evil's in the room, it's real easy. I've covered 3 wars and I've seen it in a war zone. Sometimes you don't see it when you're in civilization, but it's there institutionally. You saw it with the Catholic Church. I investigated the Catholic Church 20 years ago globally, all right? Have respect for evil. Evil is mercurial, it pivots, it changes, it lies to you, and it does it consciously without a conscience to keep you off your game. So what you have to broaden your thinking to understand what's in your arena. But when you ask a question like, who does this? Door number 1's in front of you. The people at that board, the people at the top. You don't have conversations for hospitals when they're coming under a global pandemic, coming up with a policy on how to report, unless you get people who in fact are on the board communicating with the management. The hospital administrators dictated, because the FDA did not acknowledge neurological and vascular and cardio until spring of 2021, for people who were showing up after they took the shots. And the hospitals wouldn't let the doctors like Merrick's and Pierre Corey and people like that in the ERs and the ICU practice medicine. All right? That came from the hospital administrators. But the people at the hospital, the C-suite people, are talking to the people on the board, because when they're making those kind of conscious decisions, they're asking at the board level, are we at risk? Is this legal? So they have a damage control. They have the PR people in the room. The people that had the contract for CDC, Pfizer, and Moderna is Chadwick Webber, worldwide PR firm. The guy who ran it for 20 years went to Georgetown with me. All right? You need to get the names of the people in your community and expose them, because they can't sit on the board and make decisions that affect and put your family and community at risk and let them get away with it.
How do we find them? How do we?
Oh, it's not that hard.
Name them.
You can look at the board. You can write a letter
Just
to
go
all
to
the board.
backgrounds?
Go to the hospitals. I don't know your hospital, but go at your board.
Yeah,
You still, I mean, and you go after them and you make them make statements. You drive them crazy. Think about how the Catholic Church was exposed in Delaware. And it's not illegal to do that. You have a right to ask them, if you're making decisions that puts my health at risk, how do you justify that?
So how do you pull together on some field, and to say, hey, we the people, without being accused.
You're too
of-
polite.
Yeah.
You're in a war zone, my dear.
No, I mean.
No,
I'm
you
trying
need to shift your paradigm and don't think of them doing it to you.
Yes.
Because you're allowing it to be done to you. I'm sorry, you are allowing it to be done for you. You don't ask somebody else how to do it. You pray to God that He gives you the enlightenment to figure it out, and you're surrounded by people that you're aligned and you know how to do it. You've got to shift your paradigm and realize you're on a mission. This is a mission to hold people accountable publicly.
Remember, I'm just an artist. I stopped painting like 3 years ago to go on that shit because it's just pure effing evil. We just gotta get involved and take responsibility.
Well, there are people that, we voted.
Voting means nothing.
Well, but you somebody
Voting
said
means
something about
nothing.
who's voting for Biden.
You name and shame people. You name and shame people, and you do it in such a way that you do it smartly so you don't get your ass sued.
So I just wanted to introduce you all real quickly to Jeremy Malin. He's the founder of Delaware Medical Freedom Alliance.
See?
You need those two.
Yes.
Takes a village, is what I say.
Yes.
I'd like to share a story.
I
It's
think
a little
so.
off topic, but it's an example, Pam, of how an individual can do a thing. I have a friend who was admitted to the ER because she was having abdominal pain, and it was appendicitis. It was a very severe infection. She was at DB Medical Center. She knew about the Merrick vitamin C protocol. Is it Merrick? The Merrick?
FLCCC, yes.
And so she said, I don't want to have the surgery, and I don't want the antibiotics, just give me IV vitamin C. And they would not do it. And she kept asking and insisting and insisting and insisting, and made her husband go home and get the information where he actually printed out the protocol, gave it to the ER staff. The ER staff said, okay, we'll placate you. We'll give you the vitamin C, whatever they had, which was really low dose. And she said, no, that's not enough. I need a high dose. And they did give her what she was asking for. The next morning, Monday morning, the surgeon who had said, okay, we'll let you do that, but I'm going to come back tomorrow morning and you're going to have the surgery. The next morning he came back, looked at her blood work, and he said, oh, I see the antibiotic is working. And the staff that had been there overnight said, doctor, she refused the antibiotic. But her numbers are all normal now. She has no infection. That's not possible. And she said, oh, yes, it is. That was the protocol. That's what worked. That's what I did. Thank you so much. And she left and hasn't had a problem since. It was over a year ago.
Wow.
So an individual, you have to have some balls. Pardon my language.
So what we're saying to you is you had this adverse event that happened to you, right? That you lost your job, right? So what is your mission as a consequence? And what are you going to do? You're going to join us. You're going to become active. What is the reason for that negative experience? And be empowered to make change for yourself and the rest of us. Because it's terrible what happened to you.
To expose them, but also too, I know a bunch of people. I mean, you may punch me and knock me down, and I might look at you and say, oh, well, you really are too much of a giant for me to take on, but you didn't shut my mouth.
Right, and then take
and
that.
I can be a bully with my mouth. I mean, I'm very respectful, but I'll fight that.
So you lost your job. Did you lose all your benefits, pension, everything?
I lost not my pension. I lost my job, and I lost my insurance, and I lost my husband's insurance. But in the meantime, we were waiting, and nothing was going on at that time because I kind of dipped in, talked to some friends, anything going on, what's the buzz there, and I didn't hear anything where there was any type of lawsuits or.
Yeah, you can still get the attorney from me, where there's multiple people suing. And you have to understand, Christine, this Bay Health entity, my own big practice that I work for, they were advised by our lawyers to not deny religious exemptions for their surgical centers and stuff. And the overwhelming majority of private practices that weren't tied to the CMS mandate, which is relating to hospitals and surgical centers, is different. But the private practice doctors, a lot of them accepted religious exemptions and things like that. But Bay Health was a profound outlier and denied the overwhelming majority of religious and medical exemptions. And that's why this local attorney did take the cases, and they are taking some of the cases. And it really was profound, the level.
So I have sources that have told me that at major hospitals, and I don't know if this would be considered one of them, but major hospitals, that there were some people that were at the NIH that were basically saying to the hospitals, we want you to mandate for your staff. Now, it didn't, if the doctor had privileges, he was not part of the staff, and that they were promised grants, science grants. And when you're taking a look at, Delaware schools for your
That makes
kids,
sense.
take a look at the science grants, okay?
That makes sense.
So,
Because when I say this is ATM, this is, if you think campaign financing is off the rails, I've been doing this for 40 years. This is to the point where this administration is just doling out money.
They were getting grants, a couple of years before I left, for doctors, internships, training camp.
Well, we have a new residency and intern program, but the truth of the matter is that CMS mandates that hospitals either have a certain percentage of vaccinated staff and they have to report their weekly COVID test. So my weekly COVID test is actually reported back to CMS. So this mandate needs to be eliminated. I mean, this is the degree of governmental interference and control that exists. That's the basis for it.
And really, to me, I mentioned about King David's Slaying the Giant. Every doctor, or not every doctor, every provider, hospitals, clinics, we have the opportunity to slay that giant. CMS, I'm sorry, then we're not going to accept your insurance, period.
Well,
It's going to take off a lot of people, but I'll tell you what, then that gets we the people become a giant that's bigger than the CMS.
Everybody's got their own epiphany, and everybody's got their own little rock. You're right. Worry about your rock, what you can do within your space.
Yeah.
Not everybody else, just your rock.
I know CMS is a different animal altogether, and I forget what language was in Obamacare that passed, from my understanding. But the mere fact is these are EUA, and by existing law, they can't be mandated. It requires informed consent, as we all know, and it's strictly voluntary. So why isn't anyone taking that on against these hospitals like we have in the military? Because we're challenging that in the military. There's multiple cases challenging that, and I have not seen an EUA case. Doesn't mean it doesn't exist. I just haven't seen it in the civilian realm. And not only that, masks are EUA. These test kits also EUA. They fall under the same laws. They're experimental products.
Right, but the PrEP Act for COVID protects all vaccine makers and the administrators of all vaccine and biologics.
He's not talking
I'm not
about.
talking
He's
about.
talking about somebody challenging the
Right. The mandates are unlawful, period.
And they
I
have to
agree.
do it by jurisdiction, and there's a bevy of attorneys that my buddy Bobby Kennedy and his group of attorneys are doing it state by state, university by university, school
But it's
district by
like-
it's just because you have to do it jurisdictionally.
Because in actuality, we shouldn't have to apply for religious exemptions. We
No,
shouldn't have to apply for
that's
medical
right.
exemptions. The whole thing's unlawful.
I agree.
And
The
if
Liberty
enough
Council.
people figured that out, and stood up.
Right, I agree. And the Liberty Council with Larry Mahet has won a whole bunch of cases with some of these infringements. Yeah, I agree.
The whole thing is unconstitutional. And so with CMS, and I see Congress is taking up the thing on the military, but nobody, I don't hear them, but they took up the CMS issue. And they need to
Yeah, everything is wrong about it, so what are you gonna do about it?
pass my.
Take it in, fight, and hopefully elect local and
Where were
county
you in the
politics.
military?
So again,
What part of the arms of the
you're
military?
National Guard. Here in Delaware.
Are you Rob?
Yeah.
Nice to meet you.
Likewise.
Nancy,
Quick question. Waking people up is not an easy thing because the cognitive dissonance is so overwhelming to them. Good people, good thinking people, in other times, thinking people. Can anybody offer a tip?
Yes, I can. You
A
ready?
tip to wake people up?
Yes.
It's not cognitive.
What to point
You
them
have to
to.
go. You have to go to their. You have to go and see it through their eyes.
So this is what I have learned, ready?
Yeah.
So Irene had an event called Liberty Speaks in May of 2021. And at the time, I had been doing the Patriots for Delaware meetings and speaking, and I wasn't fully into the town halls yet. And, I mean, I'm naturally shy. Like, as a kid, I hid under my desk and painted. Very, very shy, you know? So I listened to Miles Duray speak at that event, and he had a great speech, but something was just like, that is a jewel right there that's worth preserving. For me, it was like the ultimate deal breaker that made it work, right? And so it's very simple. When you're communicating with someone who you're trying to persuade to your side, use this communication flow. Empathy, facts, solutions. You've got to empathize, right? The people that are wearing masks in the car alone, they're terrified. All right, they're terrified. Empathize with that. These are the facts. 99.9% survival rate. Vitamin D works. C, zinc. Early treatment works. But it had to be suppressed, right? So what's the solution? Well, here's the solution, right? We know what the solution is now. We've known, so I've been doing our town halls nonstop for the last 2 years. Well, other than the last calls, but. So empathy, facts, solutions. You've got to connect with them and then share information that's valuable and find a way out together, right? Because don't forget, we're not battling the people on the street. It's the overlords that want us dead. That's who we're battling. They just have us all fighting each other right here so we don't look up at them in the nest, you know?
I find it difficult to get people to, even if I offer to show them, you know, I'll bring my computer and I'll show you some sites, some things that you can read, point them to the information. They can't break through that.
It's not a matter of breaking through, it's called willful ignorance.
Willful
I choose not to at this time.
So just wipe the dust from my feet and move on.
And don't get burdened with the emotional rejection of it, because when people do wake up, I don't know anybody that I know that thought I'd lost my mind in the last 3 years, okay? Because I was at the very early of 2020 said something's wrong with this picture. And when Fauci said remdesivir in April 2020 on the couch with bricks on the other end, and Trump was at the desk, I said, no, that doesn't make any sense. The nurses I was talking to in the ERs and the ICU who were supposed to be talking to the press were telling me, Christine, you guys in the press need to do something because this is wrong. By the time people get to the ERs, and we know 80% of them aren't going to make it on the ventilator. So they're telling me this across the country. The guys who are trying to get money were saying that the patients should be put on blood thinners because the disease, the virus, whatever you want to call it, was causing the blood clots. They need to be put on antioxidants, and they try to get money from BARDA to reduce the load. And this was international consortium. There were people who had done this for cancer before. They weren't getting the money. The money that was supposed to be given. I mean, think about how weird this is. So our government has spent $1 billion on studying COVID long haulers. I've been interviewing now vaccinated all over the place. They're on our network sites. And the government has not acknowledged the neurological, the vascular injuries. And I do believe it's because they don't want the vax hesitancy out there. But while they have put $1 billion into study the COVID long haulers, they haven't put a dime into studying the vax injuries.
Right, and early acknowledgement and diagnosis of the vaccine injured, because IVIGG for myocarditis, post-vaccination myocarditis, and subclinical CIDP, and various progressive neurological disorders. There's multiple studies from previous vaccine injuries that IVIGG administered early significantly has improvement. And also, some more hope, right? Go to a naturopath because the state of
and we are set up. We're set up for it. So
right. You're set up for IVIGG.
And many
well, we know people that do that, but we do have naturopaths that are all.
You guys are winning the war against us because the vax injured are not getting help from the people in the traditional medical community, except for the Pierre Corey's, the pulmonary, the frontline COVID alliance guys. But I hear from the vax injured, and they all have multiple issues. All right, I hear from the vax injured because they're not getting help from their own doctors. They're not getting help from the traditional medicine. And there are some people who are MDs who have turned into alternatives, and they're for those difficult cases they're moving to you. Yeah, so the wellness community is important.
All right, we have one neurologist that's treating them here, so I sent it
He's in your note. Oh, yeah. We'll put you on SSRI.
tonight.
Yeah, we're starting to tackle a little bit.
Yeah, she has it in her body.
Is it trembling?
Oh, she said, you can't see it, I can't sit down. My house.
She needs,
She needs.
oh, no, it has happened.
Every doctor.
I don't know if one of those seats is.
They're throwing her in the psych ward.
Is she in Delaware?
No, she's in Maryland. She's
Doctor wants
in
the magistrate.
She needs to get in touch with Pierre Ford.
Yeah. So FLC, I'll give you
LCC Alliance, not the front line.
No, here, I'll just give it.
She doesn't give up on those. And there's a guy named Celebi. There's a guy named Celebi who's an MD who's been on your, it's a just difficult one.
Right. Well, I know, Praxis and I have been.
I like that.
She's so overwhelmed.
I'll leave them around.
She's realized.
I can see that.
So she believes it.
Thank you.
I mean, my
Well,
God,
if she didn't, what the hell do you think is going on?
They're listening to mainstream media, they're not getting the information.
Actually, the president.
Talking to somebody at work about it, so we can talk about that.
it's just a couple of 2 million.
They called them, when Dennis Carroll called them legends, I said, I gotta get these people on
It
camera.
was over 1 million for my girlfriend.
It was over $1 million.
Yeah, in my video, yeah.
Doesn't matter.
Everybody can't stop recording because what's the point?
I'll send you guys about 10 links.
So like a year and a half ago, most people stopped recording. Nobody was paying attention.
I'll get in touch with somebody.
Well, I do. When I start seeing commercials that have 50 teenagers and a stroke, I'm like,